And welcome, everybody. We're now convening the board meeting of May 21st, 9 a.m. at 9:09 a.m. Again, thank you for hanging in there with us as we go through our procedural stuff. So with that, appreciate everybody being here as well. And who do we get to pick on today? Let's see. See if our district attorney would lead us in our second Pledge of Allegiance, which is also on the agenda. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Good. We're all good and warmed up. Now, actually, I have a question to council too. I had thought we had an oral communication section on this. I know we don't have to for special meetings as well, but will we have that as a comment period?
If your board chooses to allow it in something that is not related to this agenda, I think you can do that. Okay. My recommendation to the board would be we amend to allow an oral communication section for anything not on the agenda. That was, I think, a mistake and oversight on my part, but all right.
I'm fine with it. I don't want to go off on tangent, but I do think we talked about this in the governance manual that we did decide that we wouldn't do oral communication on special meetings, but I'm okay moving ahead. Okay,
great. So with that, without opposition after pledge here, we'll open up oral communications for the board meeting. Again, you're correct, not a requirement in our governance manual, but if there's anybody who is attending the meeting would like to speak on something that is not related to the agenda at hand, please come on up. You'll have 3 minutes, and you know the drill.
Yes, I do.
Good morning.
Good morning. I'm John Flynn, your political watchdog. I want to finish up for tomorrow that I wasn't able to finish yesterday. And this has to do with recorder Kanan Whitman and also Christina Nixon, Tuolumne County Health and Human Services Agency supervisor. This happened on the April 28th, Monday through May 1st of 2025. And it was April 28th and 29th. Anyways, I want to read this. It's a statement for them, but it's a statement for you. In California, violating your oath of office can lead to various penalties, including imprisonment, fines, and removal from office. Perjury, lying under the oath, carries a 2, 3, or 4 years in state prison, according to Government Code 1368. That's 1368. And there is also ethics and public corruption laws and penalties that apply here. And this pertains to Kanan Whitman, your recorder. I was trying to get something recorded. There's no legal action going on with my landlord, Tom Holloway, and I'm a renter. And I asked him on Monday, April 28th, his office to record, had a cover letter, request a record, private common law notice. Dear clerk, please file enclosed for the recording for the following document. Common law notice of La Penza affecting real property. And he responded the next day, it's not signed. I was told on Monday that the legal department, the senior county counsel, will have to review this paperwork. And it was just one page, page 2. And I said, that's Sarah Carella. And the lady kind of, yeah, it is. And she didn't seem to know who she was. And and so he wrote back and said, I will be jailed if I try to refile. And he's using discretionary at it. It's not, he said, I'll be jailed 6 months, $1,000 fine. I will be also, God, I'm so nervous on this. But anyways, he's not signed it. There's no signature. Sarah Carella's signature is not on it. They always sign something in the legal department. And I am perplexed by this, but I also want to see a public records request. I would like to have Kanan Whitman's law license Is he practicing law without a license in this building? And is he going behind the back of Sarah Carell? I don't know if that's true or not, but I would like this follow-up. And is that it? No.
And that's your time.
That's it. Thank you.
I will just ask one follow-up. Would you like to make that, is that an official Records Act request?
Yeah.
Can you send an email to the county?
Yeah.
Great. Wonderful. Thank you. All right. Do we have any other oral communications? Again, this is for items not on the agenda. All right. Going once, going twice. All right. We will close that and open up with the clerk can read our item number 1.
Item number 1, presentation, discussion, and board direction on local housing and homelessness grants and projects.
Okay. Good morning again.
All right, good morning. Annie Hockett, Health and Human Services Agency Director, here with a team that I'll introduce shortly. On April 8th, we presented to your board a very high-level overview on various homeless and housing programs occurring within the county. Following that presentation, your board asked that we come back at a later date to dig a little deeper into some of those projects. Specifically, you requested that we take a look at all available data to determine overall housing needs in the community. We wanted to have a further discussion on the sanctioned camping pilot program and options for further operations. And then a request for a thorough review of all grant funding related to the projects with a focus on long-term liabilities. And then you also requested that we provide some recommendations from staff on kind of how to move forward. So that is how we kind of have oriented the morning. With me, I have Tammy Mariscal, Behavioral Health Director. I have William Vanderheiden from our Unhoused Unit Supervisor. We have partners from ADCA, Denise and Eric. And then we have Shelley and Tom representing our Homeless Services Committee. Aside from those that you see here at the table, many, many other individuals contributed to this day and this presentation, many who are in the room that I think you'll hear from later. Certainly just want to thank everybody that I have reached out to in the last few weeks, especially other county departments. I've had questions like, I don't know anything about this, help me figure this out. And I think when working on such a complicated process, I feel so grateful to have the colleagues I do here to be able to work through this really complicated issue. Also, just want to give a shout out to Health and Human Services staff. They've heard a lot from me about this. So we have Wendy and Michelle in the background. Amy Arndt, I want to give a special shout out to, who has just really jumped in. Of course, our sheltered team. Also, Corinne from Public Works. We've been working really closely. Sergeant Benson from the Sheriff's Office. I'm probably forgetting folks. Many agency partners. We have Resiliency Village, Refuge Recovery, Chicken Ranch, CNVC, Area 12 on Aging, ADCA, Master Care and Adventist Health, all who have contributed to this. So it truly is a collaborative effort. We've designed the morning to kind of go through a fair amount of information. There'll be some decision points that we want to make towards the end. I think, in light of how many people we have here, and obviously up to the board discretion, but we would be recommending kind of going through all the material and then bringing it back for those decisions at the end. But we're happy to pivot and do that differently if so required. So with that. Would
you prefer questions as we go, or would you prefer questions kind of at intervals?
I mean, I would prefer probably at intervals,
okay,
or at the end, just because there's so much interconnectedness with all of it that maybe we will answer that question as we kind of get through the material, but certainly happy if there's a burning question that you're concerned you'll forget, you can certainly interrupt us. How's that?
Thank you.
Okay. And then I do want to see if we can show the presentation up there. There it is. Okay. Okay, so again, a fairly complicated topic with many intertwined components. We wanted to provide a comprehensive enough dive into this information with also recognizing that we could probably spend 4 days doing that. And so we really tried to kind of make it as succinct as possible, but still give you guys enough information to make the decisions that you want to make. We do have the architect for Creeks planning on calling in via Zoom at 10 o'clock. And so if there's any specific questions regarding that component of these projects, Carl from Four Creeks plans on joining us at that time.
Good. Let's plan to pause at that time to make full use of just specifically if any particular board members have architectural or engineering questions. Could be anybody.
We will do that. I will note also that we are going to focus on those projects that are not operational. So you don't see up here the Navigation Center, you don't see Parrots Ferry. We did talk about those at our last presentation. Happy to go there if there's specific questions. But again, recognizing that that we have some decisions to make on some of these other ones. So that is kind of how we structured the morning. Okay, so, you know, I felt like this might be a good just kicking off point to review kind of some of the milestones that we've had locally. Certainly homelessness has been a topic of concern for like locally and at the state for some time. Certainly we saw kind of it turn into like I would say a full-blown crisis about 2010 when you just started seeing a lot more visibility of it. We saw the challenges with housing affordability. And then the overall conditions really highlighted that our vulnerable populations in particular struggle in this area. It certainly became a heavily debated topic during like the 2018 election. And what we saw with that is we did see some funding start to kind of come in to address that larger issue. I think because of all that, the board back in 2020 did approve a homeless service coordinator position to start trying to coordinate local efforts and make a real impact in this area. After that, we did have the commission that was formed. We do have representatives of that here that will speak in a minute, so I won't go too much into that. And then in 2022, your board approved some homeless service priority projects, and that's really been kind of driving certainly HHSA and the committee in terms of how we're moving forward with some of this. Below that are just, again, a couple of kind of key milestones, if you will. We were going to talk about the IRF grant, but we received that back in September of 2023. We did do some work about critical infrastructure and clean and clear ordinances. At the time, there was some legal issues that we needed to manage. Sarah might be talking about that later, I'm not sure. But we really needed to make sure we had a way to kind of manage the challenge specifically with encampments at the time, and so a lot of work went into that. There obviously have been some legal changes to that space. I'm happy to talk about that later. But really that was the crux of opening Camp Justice, which we're going to spend a fair amount of time talking about. That became operational in July. We opened Parrots Ferry in September of 2024. Thank you for that correction. And then we opened the Navigation Center in October. So again, one of the requests was to take a look at the data that we have available, what's kind of driving our forward progression, what are we seeing as the need, the impact, and so tried to pull together what we have readily available to us. I'll start briefly with the Homeless Services Dashboard. I will note that we have made some updates to this to better reflect the work that is being done, and so that is why you're going to see some data points at 0 because we had not been tracking. No, I shouldn't say we haven't been tracking. We haven't been putting it into the dashboard. So what you're going to see up there is some new figures about prevention. So we do a fair amount of work in the area of prevention. If we have somebody that's just about ready to become homeless, if there's any sort of interventions we can do to prevent that. So we'll start to represent that through this venue. We also wanted to make sure that we were showing the difference between kind of temporary housing and transitional housing. Transitional housing is going to capture those projects that are time limited, so the Navigation Center, the trailers that we're currently running. And I will note that this does exclude any of the behavioral health housing projects because that is different than general homelessness projects, and Tammy, I think, is going to touch on that at some point. And then we tried to better reflect kind of the workload, if you will. So we've kind of broken it up to show how many cases we're actively case managing versus how many new cases are being assigned in the time period. And then that social service pending cases, that is actually our wait list. So we currently have about 358 people on our wait list asking for services that we are not able to support at this time. PIC count, I think everybody, certainly on the board and in the audience is probably familiar with this, but just a representation of that uptick. That is matching what we're seeing in California in terms of the overall need continuing to increase despite some of these efforts. There's definitely been more emphasis lately on making sure that we're doing a thorough PIT count because that does drive the funding. I'm not sure if our ADCA partners are going to talk more about that, but just to reflect that it is something that we look at and monitor. It obviously is an underrepresentation because of how that data is collected, but it is at least some metric that we can look at. And now I'm going to turn it over to ADCA to talk a little bit about the data projects that they support in our region.
So, you hear me?
No.
Okay, so I'm open for questions as we go along. So I have a few different slides. First of all, I'm the data manager who tracks homeless outcomes for homeless people who are either homeless or at risk of being homeless. And I work for Tuolumne County. And I'm a little bit nervous. Okay, so my first slide is what is called the HUD System Performance Measures. And what that is when we upload the data, HUD will give us a few different performance measures each year to let us know how we've been doing. We don't necessarily have to go through each one, but we can go to the next slide. And this is the HDIS system performance measures. And these are the state, so the state tells us how we've been doing. You know, why don't you follow up?
Oh, okay. Good morning, Denise Cloward, ADCA Housing Director. So yes, we've been doing this for quite some time. We actually started the HMIS system here in the Central Sierra Continuum of Care. As most folks know, ADCA is we have a lot of projects in different counties, but we are also the lead for the Central Sierra.
And sorry to interrupt. I just want to make sure with access to Tuolumne, just had a text from somebody that they're seeing video and audio skipping and cutting out. So you can confirm that's happening. Is the second? Yeah, so just double check. Please continue, and we might interrupt again if that is happening. We have to figure it out, okay?
Okay.
Thank you.
So as the Central Sierra Continuum of Care lead applicant, to be a functioning COC, you need three things, right? You need to regionally submit an application. You need to have a governing board or structure, and you also have a functioning data system. So when we first started this, ADCA and a few, maybe like 11 other providers in 4 regions were putting data into a system, and it was just HUD, right? But since then, it's become the state or HDIS, that's your HAP money and those system performance measures. We also have the California Department of Social Services and then all of your healthcare providers. So needless to say, the data system has expanded exponentially. So it's really important that leadership understand to analyze the data and to understand the projects that are in the system, the transparency of if those projects are doing well, right? Where the bottlenecks are. So, I mean, I'm not a big analyst person, but it's so important because there are a lot of projects that have been funded after COVID, and we need to be sure that we understand which ones are doing well. So that's what the data system does, along with let us connect with each other, right? All of us are serving clients, and those clients are connected to behavioral health, social services, mother-lode job training. I mean, it's just, there has to be 3 to 4, sometimes 5 different service providers to actually help a family or an individual leave our shelter or Camp Justice and go to somewhere that is successful. So by using the system, we talk to each other.
Great, thank you. And I think I've had secondary kind of confirmation. Do we need to recess the meeting for a little bit? So we'll just do an early bio break, coffee break. You let us know you need anything. We'll take a recess until 9:37, 10 minutes to kind of figure this out.
I just want to say the point is if we can encourage the board to understand that analyzing this data is so important. The reason for that is it is connected to funding. It's all, we are all connected to each other now. ADCA used to, when I was hired, I'd go get competitive grants, and then those grants would come to ADCA, and then we would serve people, and that was it. But now, if we don't move these system performance measures regionally, we don't get the money. So, and Tuolumne is the heavy hitter. And by that I mean there is the most funding in this county. So whatever system performance measures you agree on to do, to move the needle, you'll move it regionally for Mariposa, Calaveras, and Amador. So that's why it's so important to understand the data and analyze it and know your projects and know which ones are doing right and how to move forward. So I'll give this back to Eric real quick.
I think we're done.
Oh, okay. We're done. And if you want to take a deeper dive into data or coordinated entry in that repository, we'd be happy to have a meeting about that as well.
Shall we take a pause real quick? If there's any board questions on, I believe that stood for logarithm, which is a very unpleasant memory.
Well, that was basically just a regression line to show that, we can go back, so to show the amount of coordinated entry usage and how that can predict permanent housing outcomes. So as you see it, as you move to the right, and that again is logged.
And I said I would never use that in real life.
You do have to do it.
Here we are, 33. Do we have any questions by the board? Supervisor Holland?
Okay, I heard a new term, the Central Sierra Continuum of Care. What is this? I just haven't heard it before.
The Central Sierra Continuum of Care is a 4-county-wide planning group in an effort to end homelessness. So if you would like to go to the website, it's centralsierracoc.org. It's Mariposa and Tuolumne, Amador, and Calaveras. That's how the states and the feds recognize us for dollars.
Okay, that answers my second question of who it is. And then, are these the county? So you talked about the board of this group. Who's on the board that is controlling the Central Sierra Continuum of Care?
I am a board member.
Okay, I'm assuming there's more.
Yes. You're going to ask me for that list. I don't know if I'll remember everybody. Calaveras County Health and Human Services, Victory Village.
Oh, all of the
Is that
folks.
what the question is? Who's on that board?
Yeah, not so much their names, but like, is it one person from each county of the 4 counties?
Yes,
All counties are
absolutely.
represented, yeah.
We do have good equal representation from all 4 counties. That was something that we started with. The very first round of HEAP dollars taught us that lesson. We weren't ready because we were still kind of small potatoes, and we didn't have the governing board or the structure set. So we took that very first pot of money that came from the state and we just divided it by 4 because we knew that was the right thing to do.
HEAP?
Right.
HEAP?
Yes. And that was the Homeless Emergency Aid Program. And that was in, I think, in 2019. And we wanted to avoid issues. We knew that there were some folks that had legal backgrounds, and they said, what are you going to do, Denise? And I said, we're going to have to divide this by 4 until we get a better governing structure. So we did. And we do have really good representation from all 4 counties, from domestic violence providers, all social services departments, VA. There's health partners, so all of Anthem and HealthNet and all those guys. So we're about at 100. We send out about 150 invites to those meetings monthly. So I encourage you to attend. They're quite informative.
Okay, and then you also mentioned that we are the heavy hitter. I'm assuming you mean Tuolumne County?
Yes.
Why is that? Or what makes us different than Mariposa, Amador, and Calaveras?
Your geographic spread, how many homeless people you have on any given time, and your rent burden cost. There's a few other things that go into it that the state decides. But mostly it's the pit and how many you need to serve.
So by that statement, as in we're getting more dollars because we have a higher pit count, is what
Correct.
you're saying, than the other
Yes.
3 counties?
And your geographic nature, and also, I don't want to misspeak, but I know it has to do with your RENA and some other things that the state does for the formula.
Okay,
Yeah.
thank you.
And maybe one follow-up on that I think would be helpful. Could you explain with the continuum of care counties, I know that a change was made before where we, I believe, directly take our funding and then allow contracting. I think that's not the same as the other counties. Can you explain a little bit about that?
Really?
I can give it a shot. So yeah, there's been, we're now on to round 6 of HAP. And so it's been handled differently kind of over the different rounds. Currently, the option that we have opted for is that we redirect our county portion to the COC, but we retain control of how those funds are spent within the county. And I think that's probably the simplest way to explain it. In the past, there's been options where we have maintained all of it, and then we've been having to control the reporting and the administrative piece of that. But if we redirect that to ADCA, as the current situation is, then they do that piece for us. But again, we can make sure that those dollars are being focused in Tuolumne County. And I'll see if Denise wants to add or correct anything.
Just that's what the state encourages, is that all those redirects happen. It really shows a collaboration in your continuum of care, and it shows that your governing board and those that are voting on projects and really understanding, once again, the data to move the needle, that everybody's talking to each other.
I was understanding like why we might, for the Regional Housing Authority, have them, we say, hey, we should get a project, but they develop it, go find the site, and then bring it to us and we just approve, as opposed to this where the county has been more hands-on in these projects. I think some of the other continuum ones, the projects are from the continuum somewhat. It's a little more independently figured out and navigated. Is that correct?
Yeah, I think, again, the shift from my understanding was just to make sure, because we are a 4-county COC, we wanted to make sure that the funding that we were, that we needed for our programs were dedicated to Tuolumne County. And so the way that we have worked that agreement out with ADCA, we're able to do that while still getting the COC to support and work together on.
Great. Supervisor Grief, did you have a?
I do, thank you. Could you go back one slide?
It's not keeping up with, oh, there it goes. This one?
Yeah. And kind of a trigger point for me is I know a lot of people, we use a lot of acronyms, and I appreciate Supervisor Brandon explaining what HEAP was. I thought when I heard a heap of money, I didn't realize that was actually an acronym. So for myself and others maybe listening, can we not use as many acronyms, or at least let me know what we're talking about? So now I know there's not a heap of money floating around. All right.
That is a not great acronym now that I think about
Right,
it.
I know.
Yeah.
I thought it was
Right?
it
was a heap of money.
Well, I know, and
Heap
nobody,
and pile.
and the funny
you
thing is
know,
nobody, and everyone's
yeah.
like, oh, okay, there's a heap of money. Oh, all right. So now that I've derailed that, so line 10 is obviously our county, and could you tell us is the total number of clients that 228 is that? I guess I'm trying to understand this diagram, this matrix here.
Okay, so first of all, you see your agency, CE means coordinated entry, and that is, I know that's not your question, but that is the amount of people who were entered into coordinated entry in a fiscal, or in a year from April to about April 1st.
Okay.
The next is the amount of people who Tuolumne County put into HMIS. What I kind of like about this is if you scroll all the way to the right, you'll see exit to permanent housing, and you'll see the amount of people who were in HMIS that eventually in that year went to some type of permanent housing. And I think that's kind of the main goal for everybody here, is to get the homeless people in the permanent housing. So that's when I did the logarithm and the log chart. That's why I used that, because I think that's like success.
Okay. And then so the street outreach, is that boots on the ground, contacting people and trying to helping them find ways to find services?
So I manage mostly the data, but I think your question is correct. Would that be correct, Denise? Yeah.
Okay. And then the one thing that kind of, and then Mariposa, I know that's obviously not us, but their total clients is 357 as opposed to our 228. Does that just means at that time they recorded that amount of?
That's the correct answer, yeah.
Okay, all right.
Okay. And I said go to you next, but we have Supervisor Kirk on the behind screen tab there. Supervisor Kirk?
Yeah, thank you. Since we're on that chart, my question about the 16.35 exit to permanent situation, can you just clarify what that means? Is that exit to permanent housing, subsidized housing? Like, what is that?
That could be various things. When we upload data to HMIS, we run what's called an APR acronym, and they give us people who go into permanent housing, so it can be subsidized or non-subsidized.
Okay. Looking at some of the other counties, maybe a little comparable, but I wouldn't say that's successful. And is that, maybe Annie, this is a question for you, is that because we just didn't have the bed space, or that program success failure type rate?
Yeah, I mean, I think certainly we still are challenged in that area of having a lot of permanent housing options. That's that end of the spectrum that we've been working to build on. I think that's certainly part of it. I think we've also just really made a concerted effort to make sure we're doing good data entry. Our partners at ADCA are really good about making sure that we know how to record this accurately. And so I think we're just kind of like looking at that percentage as some of that data entry errors that might be part of it. And then I think also just we still struggle with that, that end of the spectrum and having a lot of options for folks in our community.
I know Calaveras County hasn't done much. I mean, I don't know a lot about their county, but I know they haven't done a lot of the initiatives we have, but yet they have a better success rate. Do we know why?
I don't know the answer to that. Maybe ADCA might have insight, or no.
Go ahead. I don't have an answer for that.
I will say that it's, and poor Miss Hockett and Miss Art and everybody that we harass for data, it's true, we do, but part of the reason we do that is, once again, it's part of our reporting as the HAP administrative entity, so we do a lot of data pools, and we make sure that everything is clean and it makes sense, not just for Eric's reports, but also to continue to receive the dollars and avoid any questions from the state. But behavioral health has a lot of projects that are entered from other counties in permanent situations. So the fact that those might be counted and projects are added from other counties might be a reason that those numbers are elevated.
And Supervisor Kirk, I know this is more on the ATCA side, but I believe that the Community Action Agency funding, you probably could explain it better, but operates a little different between ATCA and is it CMCAA, the Calaveras Mariposa one that redirects back in? So our numbers are split between ATCA and ourselves. They're more internal, right? Does that make any sense?
I'm not sure. I know the answer to that or the question.
Okay, never mind.
But we can
They
certainly.
do their Community Action Agency differently.
Yeah, we can certainly kind of do a deeper dive into the data. It sounds
So-
like that might be a.
Long story short, could it be that our data is more accurate and thus it reflects perhaps more negatively than the data that's collected by other agencies?
I would like to say that because of AB 977, that is untrue. And so we do have grant identifiers that are mandated by the state. So all social services departments use the same programs and put those grant identifiers, excuse me, into the system. So if HDAP is here and HDAP is anywhere in social services, that grant identifier is in the system, and they are putting their clients into that program, into that project. So they are mandated to use the same grant identifiers.
And could you define HAP for us, please?
Oh, I'm sorry, I did use an acronym. The housing, it's a disability assistance program. So, and it's through social services.
Housing,
and homelessness
disability, advocacy,
Advocacy
prevention.
program, there we go.
And
program.
Supervisor Kirk still has his hand up, and then I had Supervisor Holland in the queue, and then we'll be able to go back to either to Supervisor
Yeah,
Kirk.
I'm still confused and don't understand why we're off by over 50% or 100% with Calaveras County. So Annie, I don't know, maybe a phone call to figure out what the discrepancy is, but it's a pretty important number. And then my last question is, Annie, are any of the projects that our board has funded the last couple of years up and running and included in this data, or is this more just things that were operational before? Because I know most of what we've approved is still pending operation other than the...
And I'll look to Eric to confirm, but the Navigation Center is a project that we have set up.
If you want to go back a couple slides, or actually I think to the 5th or 6th slide, we can look at all the projects. It's in a small Excel sheet, so it might not be the easiest thing to see. Okay, go one more. Okay, so we're looking at the Tuolumne County projects. These are all emergency shelter and transitional housing projects. Let's see, if you see something that says Nav Center, that's obviously the Navigation Center, so yeah, near the bottom. And since we're looking at it, if we look over to the 3 or 4 columns on the right, you'll see households with children. Those are, that's the bed inventory. And you'll see the numbers of beds for housing households with children, without children, and then active clients, the clients who are currently in that project when I ran this report a couple days ago, and then the utilization rate.
Okay, so anything that Tuolumne County has up and running would be included in this current list?
Anything that's emergency shelter and transitional housing. I didn't include rapid rehousing projects, which is more of a permanent housing project, so I just included ES and TH, emergency shelter and transitional housing.
So emergency shelter and what else?
Transitional housing.
Okay, so Annie, with emergency shelter and transitional housing, this is for the conversation later during this board meeting. It would be nice to know what emergency shelter and what transitional housing we have up and operational that is included. I don't know the names, I don't know the addresses of those houses, but I would like to know that for later on in the discussion.
And I can tell you quickly, Supervisor Kirk, that the emergency shelter would be probably emergency hotel vouchers that we've been entering into HMIS, as well as the navigation center is probably the bulk of the transitional components. Other emergency, I think the emergency shelter should just be solely hotel vouchers.
Okay, and then transitional, you'll have to get back to me on that.
Transitional would be the navigation center only, I believe.
No,
Nope.
navigation center is shelter, emergency shelter.
Oh. There you go.
Okay, so
No.
the only thing that would be included in here would be the navigation center and hotel vouchers. We don't have any other housing in Tuolumne County that would be included in these numbers.
That should be about it.
Yeah, I believe that's it at this point.
Okay, thank you.
Okay.
Supervisor Holland?
Oh, okay, so on the other slide we were on a minute ago where it showed like Tuolumne County, like the big old graph one. So Calaveras' count's like 234 and we're 228. So a comment got meant that because our count's higher, we're the heavy hitter, we get the funds, but my understanding Calaveras doesn't have many homeless housing options. But if they have a higher count, how are they not receiving the bulk of more funds, and why do they not have housing compared to us? If I'm looking at your guys' chart, if I'm reading that right, total clients is 234 and we're 228. I mean, obviously, I know it varies a little bit in
She
time.
was speaking in my ear. What was the direct question?
If we're looking at Calaveras, I'm going to defer to ADCA, but it looks like with their street outreach, that robust street outreach impact that?
I was looking at the total count, like 234, right? Total
those
count
are
of
the,
clients.
Yeah, those are the people who are in HMIS for Calaveras County for 1 year.
So as I'm saying, if Calaveras has a higher count, but we're getting the bulk of the funding, and my understanding is Calaveras has little to no housing, homeless housing over there. How are they not receiving the bulk of the funding? You know what I'm saying? But like, we have all this homeless stuff going on here, but they don't seem to. And if the answer was earlier that based on your population size and a few other factors, that's how the money's divvied up. What are they doing with their funds? Are they receiving these funds? Are we getting their funds? Like, how's this?
So the funding, my understanding, the PIT count really drives the funding component, especially with the HOP funding. Oh, and I see Wendy Hoffman-Brady coming up to the podium.
Hi there. I'm Wendy Hoffman-Brady. I'm the Assistant Director in HHSA. I just want to point out that the number of clients, those are the ones that have been put into HMIS. That doesn't represent the ones that we still have in waiting to be worked on, like on our waiting list. So we have a significant number on our waiting list. I don't know what Calaveras has. Also, my understanding is that Calaveras is only working with the clients that they actually can get into permanent housing, where we're still trying to find permanent housing. Those are just my couple of.
And I'll add one other thing that just popped in thanks to a text message that was just sent. The HSP program is represented under the ADCA category also. So that is a program where we divert funding directly to ADCA to provide rapid rehousing. And so some of the, I guess, Tuolumne County people would be represented under the ADCA column, but those are being served by us as well. And I don't know if
That's
Denise wants
true,
to.
and also the ERF, so the rapid rehousing piece from the encampment resolution dollars and what Ms. Hockett said, the HSP rapid rehousing piece for HSP. So ACA does enter all of those clients into the system. So it would possibly be in our category, yes.
Okay, and so when you guys talk about exit to permanent situation, I'm assuming that's where they're finding like a private place to rent or purchase, something that's not controlled or ran by the government. It's outside of government scope. And
It can be both.
What would be an example of the permanent housing that would be government owned?
Subsidized with a voucher.
Okay, well, subsidized, I mean, somebody else owns it, though. It's personally owned by a person or
Yes.
a company or something. Okay.
And they did do, I think, an earlier plan, 5-year plan, it seemed like, on homelessness in Calaveras. I thought they were about 2 years in advance of when we kind of created that. And then maybe this is to your point, and this is the acronym soup. On the top, can you define some of those? Because I'm assuming TH is not, Twain Harte, it's transitional housing, right? And in that, Calaveras at 116, is that 116 units, 116 placements in temporary housing? It's asking why the numbers are different. That seems to be the biggest thing, is they are 116 out of about 170 for all 11. So is that placements or units?
Placements. Placements.
Okay. So, okay. Supervisor Griefer?
Yeah, I just had a quick follow-up question. So going to the city of Sonora, it says total clients is 109, street outreach is 109, and their placement is 34%. Is that a contract with the county that we're assisting then, or do they have their own operational plan? And
So that represents the host program, and my understanding is that there is some HAP funding that is supporting their operations, as well as I think a few other funding streams.
oh, okay.
I would like to point out that the housing inventory count is not a slide that you're seeing today, but if we would take a deeper dive at another time into the system itself, showing you the housing inventory count would show you those units and those beds and all of the projects. And so it would be helpful for you to have that visual along with all of this other information to kind of see what's available in Tuolumne County and across the region if you'd like.
Just one thing I think would be helpful in the future where we've got large charts would be conditional formatting to kind of do the red, green to see like what's aberrant at a glance would be really helpful. But one thing I wanted to ask is this counting the housing insecure or kind of at risk of being homeless folks who are being served, or is this only counting folks who are designated as homeless? And by that, I mean, if we are helping somebody who is about to be homeless and assist them, does that count to our success rate, or is this really only tracking those that like are on the street and then we get housed?
It can count everybody, but in general, it's mostly people who are homeless.
Okay, because we went from, I remember 2 years ago, 0 placements effectively, or whatever it was, and then we, with HHSA and Rebecca, had dedicated the social workers to be able to work with the homeless population specifically, with Whitney, I believe, right? And then we had the kind of smaller caseload a little bit, and that went from 0 to like 100, now it's like 150. I would assume that those 100, 150 may or may not actually be in this if they were folks that were at risk. And I don't know if there's a way to somehow still track that where like somebody comes in who needs help in general versus somebody who comes in, I mean, like if they're coming in and they need assistance and we're getting them on SNAP or we're getting them on everything else because they can't pay their rent and they're about to be homeless, that is effectively a homeless person who is only a month or two away. And that would make our data look worse over those 2 years on that chart, even though it's a good thing.
And Supervisor Brandon, we are going to start tracking that. That's that new data point on the dashboard to be able to capture some of that work. So appreciate that comment.
And on that chart too, I wanted to ask, do we have the 2025? I thought we did have the pit count data from January.
It's the HDIX upload, so the HUD upload just began a couple days ago, so I don't like to make anything official until they accept it.
Okay.
So
We can't get the unofficial?
No. If you guys
Andy,
want
can we get the unofficial?
I don't even have the unofficial,
No.
so I don't think I
right.
can help.
This year was just a shelter count, so it's not a street count.
Okay.
Next year, we're gonna do street count and shelter count, so you're not gonna get the count you want this year.
Okay.
And I want to add something. You guys have a lot of questions. You can email me anything you want. If you want any spreadsheets, any analytics, I could probably help you out with anything. I just brought a few things just to kind of show you what we do.
Well, thank you. And I know you mentioned a few stats on and it's a good question, why do we seem to have more of it here? I mean, the numbers, there's a thought that Calaveras doesn't have homeless people, but they do have homelessness. They have that. I know that there is a couple very key differences. One of them is we've got more housing scarcity. CSEDD's done analysis. Us in Mariposa are getting much worse faster than the state. Calaveras is getting worse, but at a more normal rate, which is an issue. And then the federal lands issue, it's much more condensed here, right? They are much more spread out. But do we have anything tracking? I know that some of our nonprofits have talked about who's coming in or that data is to say that maybe folks are coming from Calaveras over to Tuolumne County, as an example, or anything like that. That there is some level of economic migration, we'll call it.
I guess I'll say there's a lot of different variables to that. But people accessing services and if you have service providers on the street to capture that time and to put them into coordinated entry is going to change in the system, right? So is that happening in one county and not the other? Well, if you have functional street outreach programs that are actually putting people into the system in a timely manner, you're going to see all those numbers grow really fast, right? So
Right.
I guess it all depends.
It's like the place that probably gets the most traffic tickets is the Fifth Avenue intersection right
Yeah.
outside CHP's office in Jamestown, because
Right.
that's where they're always driving through, right?
And it's so different between counties and Tuolalume's done so much, honestly. I mean, I've been, like I said, doing this quite some time now with ATCA. And I think that Tuolumne has so many more, wonderful places for people to come inside.
Yeah.
And there's just been so many projects that have opened. So all we can do is get better. And I know, because once again, you're looking at a spreadsheet that used to have 3 things on it, right? We have a lot of programs. So the way, once again, we talk to each other, work together with clients that are challenging. Maybe we use a grant identifier and not names, right? Take out the personal stuff. That's how we keep moving this forward. And you get to selectively, once again, choose where you want that needle to move. Like, do you want, is it more important to do A than B? And I
Right.
know that's a hard selection sometimes when funding contracts and we have to choose projects. But
Absolutely.
that might be where we'll be
Getting
headed.
the core of it, I was asking more is we have, when we're doing service stuff and it is depersonalized, aggregated data, where they are from originally. Of course, many people in Tuolumne County are not from here, but how long they've been here. That's been one of the key points. I know we've had anecdotal point of service type stuff at nonprofits, but being able to say, okay, 60% are not from here, 40% were born and raised. Of that 60%, half of them have been here for more than 10 years. And being able to say, okay, so 20%, math's hard, 30% is a transitory population under 10 years. And that's more of that would be a great chart to see, and then be able to say, this is really what it looks like in a quantitative way, using SNAP data, because SNAP is probably the most, anybody in that category is going to be on SNAP. So, Supervisor Holland?
So I was kind of listening to what Jaren was saying and listening to you guys, and it sounds like you guys have a good connection with the other counties because you guys are in all this data. So I'm sitting here just thinking about the permanent housing solution, right? I mean, that is the end goal in all of this, right? Is how do we move to that point or get people in a long-term positive solution? And I was thinking about what Jaren was saying about Calaveras being a little more spread out. And do you find that, I mean, we are geographically very similar. do they have a lot more housing options available? I mean, we talk about here in Tuolumne about how rentals are scarce, they're expensive. Are you guys hearing those same concerns in Calaveras, to where maybe part of what we need to focus on is more options, more housing, which I know we talk about all the time, but are you guys seeing that in real time? Is that how maybe they're having a better success rate because they have more affordable housing? Or, I don't know, just some insight that you guys might have that maybe we don't, about that. I mean, that kind of goes to a larger conversation we talk about, but I mean, that is the end goal, is to get people to that point. I mean, I'll be honest, 16% is not an excellent success rate. So how do we get to a better success rate? I think that's a more important question, because I think everybody wants to get to that success rate. But maybe I'm wrong, I don't know.
I would say using the system is the best way to get to that success rate. All of us functionally using the system in a timely fashion. And no, I don't think Calaveras has more affordable housing. In fact, they also have challenges, similar to Tuolumne County, in terms of building certain projects or where they're going to go and all of those things. But to record in real time, to understand which projects are funded with which pots of money, is the key. And then having intimate conversations, real conversations about what it costs to run those projects, how those outcomes are working. And if we do that, when something is failing at a property that the county owns and ADCA is working, or Resiliency Village is working on the same thing, that's when we have a conversation like, maybe we have to blend this, or maybe we get this money together. So that's my vote, is that we stay very transparent and we stay collaborative, to make sure that the projects stay strong.
And I think I got the question I was trying to ask earlier combined. So looking at this chart, ATCA, Amador Tuolumne Community Action Agency, I just was throwing out acronyms too, CMCAA, Calaveras Mariposa Community Action Agency, is structured very, very differently. ATCA, and again, correct me if I'm wrong, but my understanding, which I should have, is ATCA's got, of course, multiple different divisions and units under an executive director. It's somewhat independent of the county, though it is a JPA. That CMCAA, Calaveras Mariposa, is more of a leadership staffing, but the funds go back into the programs. It's not as much independently operated with lots of its own staff in the same way. And one of the questions I want to ask on here, so when we look at Calaveras, there is no CMCAA, right? And when we look at Tuolumne County, ours is split between Tuolumne, the city of Sonora, and about 2/3 of any numbers in ATCA are probably our county. So are these truly unique individuals, or is there duplication here where actually, I would assume, I mean, most of the time somebody comes to me, they're like, hey, we need some help. Say, well, okay, do you live in the city? And if they could do that, it's like, okay, check with the county and then check with ATCA. They're probably receiving services at all of those. So the percentage would not look good because only one can take credit for who actually got them into housing, but everybody technically has them on the record as a visit. So it's not a simpler question, but I think it gets to the point is, are we dividing our data or double counting basically visits, but not double counting successes? And Calaveras is all in one, basically.
Yeah, the same person might be in different agencies, if that's your question.
Okay, because I'm looking at like ATCA's at 28%, City of Sonora is at 34%, we're at 16%, but if there's duplication within that population and you combine those, it's more likely maybe we're not at 34, but if the mean, I don't know, ask you because you know what a logarithm is. Whatever the closer number, it might be 30 to 34 instead of 16 to 34, right?
I don't know how to answer that question the right way. Probably not, to be honest. I think then we can also say the same thing about ATCA. There's going to be 50 or higher. I would like to say one thing, going back to your question. How could you improve the numbers? It's my goal, since I'm not a boots on the ground person, I'm a data person, and I train all the users, is to get everybody to use coordinated entry for every single client. And as you see, there's some zeros there. This was early April. A lot of those zeros are a little bit higher, and I'll update this as time goes on. But I just try to get it into each user and each manager's head that the more you use coordinated entry, the better I believe your outcomes will be. And if you go to the logarithmic chart, you will see that. I believe in data and science and math.
When you guys are entering that data, like what Jaron was saying, if it could be double entered, is it being tracked by the person? So you could say, oh, look, this is the same person. So would that then, if you're cleaning up data, wouldn't you want to remove somewhere out of there? So to the point, it's not being like let's just say we only had 10 homeless people in the county, but they go to 3 different locations, and now it looks like we have 30 homeless people, 3 times the amount.
Yeah, that's a good question.
I don't know if you guys are separating that out yet, or
okay, so I can talk to our Bell Data, who is the provider for our system, and see if there's a way to do that. It's a good point you brought up. 10 people could be counted 30 times.
And only 1/3 of them would take whatever
Right.
successful
Yeah.
outcome. So that would be really good info to get.
I'll just say what I said a few minutes ago, though. I believe that would be spread out throughout the entire COC. So if you're 16, it could be 35, but then the 22 in Amador could be 45 if we were to do that. So I'm not sure how relevant it would be, but it could improve your numbers.
Great. Do we have any more questions at this segment? I think the next is we're getting into projects, or Annie?
Yeah, we can do a time check. We wanted to maybe pause right at the 10 o'clock hour to see if our,
And Annie, we have a question from Supervisor Kirk. And Supervisor, just in case if we don't see that, just unmute and say, hey, listen.
Yeah, and I'll make it quick. It just goes back to my original question of, and I just want to be clear, if we're only talking about hotel vouchers and navigation center, but we're trying to get to people permanently housed, if the goal is permanent housing, what about the programs that maybe you get a voucher, you go to a hotel, or you go through the navigation center, but then you move on to a next phase, Annie, like you go on to a transitional housing and you're there for a year or two and you get drug rehabilitation and then you get placed in a permanent housing. Are we only capturing, again, it sounds like the emergency housing, the navigation center type folks, and are we missing all the other work that's going on post potential that placement? Am I making sense?
I think so. I think I'm tracking, because we don't have those projects up and running necessarily, we would not be entering data into those buckets, but some of the community partners, if somebody, example, went to Resiliency Village and they're entering data, that would be captured, I think, under the Resiliency Village bucket, if I'm not mistaken. So, if we look just at the Tuolumne County projects right now, it is focused on the hotel vouchers and the navigation center. But as projects come up and are developed, then those buckets there'd be more buckets to put people in, if that's the right analogy.
Yeah, and I think the reason why it's important for me and the board to understand this is because if other counties have other services that we're counting, like emergency shelter, and then you go into this program, and then you transition into this, and then you get permanent place, that's a success rate. But if we're only looking at Tuolumne County, like, did you make it to permanent housing from a hotel voucher? Well, that to me is not apples to apples. And so I get that the data we have is the data we have, but I think if I'm right, and if it sounds like that is the data being presented, it's almost like you need another column in here to understand what county offers what services, because to me, 16% is not a success rate, but if I understand that we're not capturing the whole train, it's just, because later on today, we're going to discuss if we want to continue to fund certain housing projects, and if we house some but not others, it's looking back a few years from now, I wanted that dashboard created so I could see success rates. And I feel like we spent a lot of time on this and it's very unclear because, like I said, some counties may have a lot more programs, which is why they have better success rates, but we're only looking at transitional, emergency shelter. So it's very hard to get a clear picture with this, but hopefully I'm making sense. And I think we just need to keep that in mind moving forward today.
Yeah, I think it brings up your point, and I have a couple slides later that shows that this is not just a county issue and focus, that we have many community-based organizations that are in the field with us. And so when you're looking at this chart, as I'm listening to the conversation, that Tuolumne County line is just focusing on really kind of two small pieces, and it's not truly the whole spectrum of what's happening in the community. And so I hear your point of how can we dig down a little deeper if we want to make sure that we're focusing on just the county supplied programming. But that's just a very not small, it's a piece of the pie, but there's many other pieces that work together to make the whole picture.
And I very much,
I think.
oh, sorry, Supervisor?
I was just going to say to end it, I think in presenting this, it would be nice in the future to, one of these columns, add, like I said, emergency shelter transition for Tuolumne County. Calaveras County might be those plus 4 other type of programs, just so we understand what we're actually capturing. So I'll leave it at that. Thank you, guys.
And we did, we kind of started, we have all these different columns on there. I think it is there, but it's all in acronyms. So can we go through, because I have no idea what CE stands for.
Yeah, coordinated entry.
Coordinated entry, and then can you go through the rest of them on
Yeah,
the
can
top of
somebody
that
bring it
chart
back
and
up?
pull the chart up, please?
Okay, so coordinated entry, emergency shelter, TH is transitional housing, PSH is permanent supportive housing. That's permanent housing for, I believe, mostly disabled people, is that correct?
They need additional supportive services.
Okay. Permanent housing with services, that's another permanent housing. Rapid rehousing is RR, and that usually could be ongoing monthly subsidies or a down payment assistance. Services only, street outreach. HP is homeless prevention. And let's see.
Wait, what's RR again? Sorry.
Rapid rehousing, that is a permanent housing project. And then I think that counts everything. Yeah, that should just be just about it. I'd like to add one thing, the exit to permanent housing. I'm not sure if that was the previous concern, but exit to permanent housing situation, that does include everybody that's put in the HMIS, not just ES and TH, not just emergency shelter and transitional housing.
Okay.
So I'm not sure if
And-
that was his question.
And maybe just an idea spurred by Supervisor Kirk, because I've agreed, I think it's really helpful for us in the public to have a dashboard. Some of these things are hard to track because, who said it? Apples to apples? It was Kirk. Kirk said then. It's not apples to apples in that. Like comparing us with our 6% developable land density compared to an Amador that I think is 25% federal. I mean, it's, vastly more rural and lower populated. Is very hard. It's almost not so much of a dashboard as a model, right? We need to input data, but then be able to make some qualified assumptions about how those are affected. And I don't know if there's a way to do that, but like, for example, the housing issues, if our houses here are maybe cheaper on average than they are in Calaveras, but Calaveras has more availability in terms of the rental market and there's 0 rentals here, how does that affect that number so we end up with something that is a useful comparison? And we'd have to have kind of several categories of saying, well, how much does the federal lands issue, cause related to attraction? We have commercial centers. They're not going to Sheep Ranch, right? Where that's not, no offense to Calaveras, they're coming to places that have activity and fair weather in that. So I'm only throwing out that idea that would be a very interesting data and survey challenge. But if there's a way to create a model that kind of calculates some of these differences to make it an apples to apples comparison and quantify those variables, boy, that would be really helpful. Because I think a lot of the cities, they're really dealing with much more similar situations. If you're, even between, say, Modesto and Merced, there are unique things, but they are much more similar than I think our county compared to Alpine. Completely different environment. Technically, they're doing fantastic on homelessness, probably, right? It's probably 0. It's a totally different environment, so. All right, I'm sorry. That was long.
No,
Annie, take it away. Take it away from me.
Yeah, this was a great discussion. I think we definitely underestimated how much time we needed to talk about the data. So I will do just a time check, Supervisor Brandon, because you wanted to pause at 10 with the person potentially joining. So we could
Yes.
do that, or we could ask that individual call back later, or I will look for direction from you guys.
Well, consultant time is paid time. With the board's approval, I say we bring them on and start talking architectural. Great.
All right, so we haven't necessarily got to kind of the meat and potatoes of that piece, but I'm going to think on my feet here for a minute. And let's see. I think maybe what we'll do is maybe I'll just introduce Carl from Four Creeks. So Carl has been who we've been working with essentially since HHSA has stepped in to try to figure out kind of the status of the 108 and Snell Street projects in particular. So we've been meeting with him and his team weekly to get a status on how things are going. Later on in the presentation, I do have some slides about the timeline and the different properties, but Carl was willing to jump on today and ask or answer any just specific questions about the architectural process, plans, timeline. So that's kind of a scatter shot of many things that he may want to speak to, but I will introduce Carl. There he is.
All right. Good morning. Hello, board. Thank you for having us. Thank you, Annie, for setting us up and inviting us. Don't have anything formally prepared for you, just here to answer any questions and anything you need from us, we're available.
So I can try to facilitate this conversation or just be quiet and let you guys gather your questions.
He's Carl's the architect for all of these projects. There's a group RFP, right, on all the designs. So kind of the purview of what we'd be asking would be about the design of any of the projects that aren't yet built, or how was it done for the ones that were built under the contract, the Four Creeks, right?
Yeah, so maybe what we can do is we can talk about Snell. I think that's the simpler of the two. And so with that project, as this board is aware, we have an item that will be heard later this morning to move forward with that. So we've been working with Carl's team to basically get that ready to be an executed contract with the vendor. The vendor that came in with that lowest bid was Fender Construction, a local construction agency. They are ready to go as soon as the board gives that permission. They're estimating about a 4-month completion window of that property. That property was funded through the ERF grant. The figures that we have are showing that the property is coming in a little bit under budget. I will note that part of the decision making that we've been a part of is to make sure that we're going kind of with the basic bid for that project as well as 108. And I've learned that vernacular in working with Carl and his team. But essentially, when a project goes out to bid, there is the ability to add kind of additional supplemental pieces. And so our strategy has been to do the basic base bid just to make sure that we can get the property up, running, operational, safe, and occupied as soon as possible. So I did not include the timeline for the 108, or excuse me, the Snell Street property because that 4-month window is really the next chunk of that time. Four Creeks would be monitoring the construction process throughout that. And so maybe with that, I will pause, see if I left anything out, Carl, and then we could open it up for questions about Snell.
Yeah, no, I think that was great. You covered it, Annie. I can speak to a little bit about the base bid and the bid alts if there are any questions on that, but I think it's a moot point at this point. It comes up again on Highway 108 and we can discuss those then.
Maybe one leading question kind of on this is, and could you explain, and I know this was not under your purview at the time there, but why, as opposed to for these different projects, different funding, was Carl and Four Creeks put in charge of doing a joint architectural study as opposed to kind of individual by project? You know, what was the decision making on that and what was the benefit?
I'm not sure I know all the particulars of that. I think you know, obviously there was multiple projects happening at the same time. And so how the proposal came in was that Four Creeks would be able to kind of continuously work on these projects as they finished up. And working maybe with one vendor was preferred. And I think that bid came in the lowest as well.
Okay, and has it been on time and on budget?
So far, yes.
Okay. Supervisor Kirk, I see, has his hand up.
Yeah, I'll make it quick. These are pretty quick answers, Annie. No need to go into much detail. Once it's funded by a grant, what's the sustainability plan with Snell Street? Is it going to be the folks who are living there are going to be subsidizing to pay for it, or is it going to be ongoing grant funding?
Yes, it would be client pay, and that property is targeted for behavioral health clientele.
Client pay. And how many units will that be? How many bed spaces?
10, up to 10, I believe.
And you already said who's housed there. It's behavioral health clients. And you said it'll be up and running in 4 months. I mean, that's about how long it'll take to get the project done, and then we'll be up and running at that point.
4 months is the estimated completion for the construction, yes.
But then when will that actual house have tenants in it?
I would say immediately. I'll turn the mic to Tammy again, because that will, unless,
No, it's
or
okay.
immediately, it's good. Okay, yeah, I would say that we have
That's fine.
a wait list, and we have people ready to go in.
And then my last question is, in the slideshow somewhere in here, it talks about Tuolumne County housing units completed 2019 to 2023. It lists 393. Is this part of that 393, or is this going to be an additional 10 to make it like 403?
I'm going to get to that slide so I don't misspeak here.
It's not too far down from what we were just looking at.
So the 212 number that's represented, that is all community-based housing, so none of the county.
Hold on. I don't think we're looking at the same number. If you look at utilization rates for ES and TH, that there's a big, we were just looking at that a few minutes ago. It's the next slide under there. It's a black.
Oh.
It's black with white, Tuolumne County.
This here?
There you go. Yeah.
And sorry, repeat your question?
That 393, is the Snell Street project part of those housing units?
So that's a great question. I would have to research. This is a fairly new website that the state launched to just monitor progress and, connect it to funding down the road. So I would need to look into that. But right now, with 2023 data, no, obviously that would not be included. But I don't know what feeds that.
I assumed, and maybe between now and later on the board meeting, one of my questions is going to be later on, what is the total amount of housing beds that we have in the county? So I don't know if that's in the slideshow, but I need to know that for later on in the discussion, if you need to send out an email or anything right now.
We do have that available and ready in a slide.
Okay.
And
Thank you.
that is housing units from like the housing analysis for the RENA and housing element. That's all units complete in the county. That is not 393 shelter beds or assisted beds, or
That's my understanding. Just
Okay.
And I might have in my notes where that's coming from, but it's a metric of just how many new units are coming on
Right.
board.
The
Not
393
necessarily like
would
ours.
be a lot of transitional units.
Yeah.
Thinking that's got to be the Snell. Is that behavioral health? You said?
Yes.
I thought it was not a behavioral health unit.
We've looked at different models. I think
Okay.
as we look at like the forecast, the budget forecast, where the need is, where the funding is shifting, we think that that's the best utilization of that property.
Okay. Supervisor Holland?
Okay, I got some questions for Carl here. So, I'm looking at this a little, so on Snell Street, we pay over $500,000 for 2 houses that I'm assuming were rentals up until the moment we sold them or we bought them, probably removed the tenants. Why do we need to go spend another $250,000 plus 50% of the purchase price to make them different? I'm a little confused on what needs to be done if they were active rentals that people were living in up until the moment the county decided to purchase these for over $500,000. Like, what needed to change in them to provide housing? I mean, they seem like they're houses already.
Yeah, I'm happy to speak to that. So the scope of our work on that project was to deal with some drainage issues that were on the site. So the houses back up to a hillside, and there's really bad drainage. There were some DIY efforts over the years by previous residents to kind of try to redirect water, and there was, it was clearly not working. So our scope, directed by the county, was to reroute the drainage and provide a way for that to not also run down to neighboring properties. And sorry, there's a big echo. I don't know if you guys are hearing that or if that's just on my end, but
I think it's just on your end. So you said it was directed by
Okay,
the
okay.
county, like is the county putting the scope of your work together, or you go out there, look at the project and creating a scope of work that needs to be done for $250,000?
Correct. So, I mean, well, both of those. So that was in the initial scope of the project, in the RFP, or it may have been in the site walk during the RFP process. They mentioned that there was site drainage issues, and that would be part of the project to deal with that. So we had a civil engineer on board. We had a survey done. The site was re-engineered to redirect that drainage. Part of our project, or part of our involvement in projects, is always to go in and assess with our own eyes what the situation is and offer recommendations. And in this case, the project is very close to what the RFP scope initially was for the project.
Okay, and I haven't seen the RFP, so the work we're doing on Snell Street is just a drainage in the backyard? I'm boiling that down.
So yeah, the drainage is the big issue. Sorry, the drainage is a big issue, a big part of the costs, and both houses are also getting new roofs. So that was also in the RFP as well for the initial scope.
Okay, so we're not changing essentially the interiors of them. We're just putting a roof on them.
For our
fixing
part,
the
no.
drainage.
Right. Yeah, I apologize. I think there's a little bit of a lag, so I don't mean to interrupt you here. There were various repair items that came with the inspection reports when the county purchased the property, and some of that work is interior, so that's not in the scope of the final project here that went out to bid.
Is that on top of the current bid, or you said that's included? Maybe I missed what you were saying.
It is not included in the bid. I believe the county maintenance staff, or I'm not sure who was handling that, but somebody was taking care of some of the interior maintenance items.
Okay, so maybe that's an Annie question. So if we were to approve this contract for whatever the dollar amount was, Defender, and they go out and, I'm assuming they're replacing the roofs, solving the drainage problem. I think that goes back to the previous question is, are the houses then ready to rent, place people in, whatever we're calling it, right then and there? Or like, oh, there's this other list that you guys are gonna show back up to us later?
I don't know of another list. I know that, I've personally walked through the buildings. They look like they could be move-in ready. I think there's some furniture that we've purchased and have ready to go. So I'm not aware of any interior issues that would prevent us from occupying them and or create additional budget issues.
And Supervisor, because I think there might be a disconnect on that too. There's the physical improvements of whether it's move-in ready. I know with the other projects, there was a lot in terms of did it meet with the neighbors, having the lease agreements, the recruitment process of it. Some of them were management if it was a managed site, that there were other steps when we had spoken that going through that were not construction related prior to Rafferty opening.
Yeah, I'm just talking about construction stuff, because Carl brought up that there was, we'll call it deferred maintenance inside the houses, or, probably a pest report that showed rot or whatever else. Are those items being addressed? If you're saying there is drainage issues, I'm assuming water's touching the siding, which is gonna cause the dry rot. Is that all included in this bid, do you know? To be done?
Is that a question for me?
Somebody, I don't know, whoever.
Yeah, sure. The drainage is, that's included, to keep water away from the house. So everything is just running right up to the houses currently, which I did just get a text message from somebody else on the project here that let me know that the houses were vacant at the time that they were purchased. And it was when the county was working with the neighbors that the drainage issues were identified.
Okay, but you said there was some, I'm assuming through a pest report or something, that there was probably dry rot or damage to the siding and some other stuff from the water touching it. Is that included in this contract they want us to approve? I guess that's what I'm getting at. Is there other construction stuff that is going to show back up that we don't know about right now?
So the county does have inspection reports for these properties. That work was not included in the final bid. So everything was external of the buildings. I do not know the status of the maintenance items in those reports. I know some of them have been taken care of. I'm not I'm not sure the status of the whole list.
Okay, thank you.
And there are various issues like a toilet that needs to be tightened down and a burner that may not have been in working order. So, yeah, those kind of items.
I think that might be helpful if we can have access to the reports on those. I'd be interested in seeing through. That's good questions. Do we have any other questions? Supervisor Griefer, Supervisor Campbell? Yeah, Supervisor Griefer.
So on the utilities, I'm sure it's not 27, or is it 2,700 or is it 7,000? That the utilities for 6 months?
Got a lot of slides in here, don't I? Yeah, 2,700. Oh, there's an extra zero. Yep.
Okay,
Just kidding. Just making sure you guys are paying attention.
And, well, you caught me. And is that what we've already paid, or is that what we expect to pay
That
every
was
6 months?
my projection to pay pending the construction being done. So I did include 6 months window just to be a little safe. But again, the estimate is 4 months to complete.
Okay. And then you said it's, I think Mike asked if it's 10 spaces. Is that for individuals or is that families?
It could, well, with behavioral health, and I can let Tammy jump in, but, well, I'll just let Tammy speak to that.
Hi, you know, we really try to, through all of our different housing initiatives, is to match property with clientele. So we actually have discussed it being more of a family oriented property. Yeah.
Well, I guess this will be for Carl. So in the event that we don't have families to put in there, right, are we going to then have to divide those rooms and put individuals in those rooms? Or if we don't have families, is this probably just going to sit vacant until we do have families?
Yeah, I would never expect that it would be empty. We have identified families or couples on our lists. I can't say that it would always be family. We definitely do not intend on refurbishing Snell, let alone any of the other homes, really leaving them structurally sound in the way they were built and meant to be used. And would not exceed the 10. 10 seems to be a lot to me. So I would not think that we would go to a 10 capacity within the calendar year. And it really all depends on the clients that we identify when the property becomes available.
Okay, maybe I'm not asking my question right. So on the first page here, it says 3 bedrooms, 2 baths, and the second building is 3 bedrooms, 2 baths. So we haven't changed the bedrooms.
Correct.
Right? So in theory, we could have one person in each room,
Yes.
right? So it could be just one person there. So at the minimum, it would be 1 and 1, so that's 2. Or it could be a family of X in there. So I'm just trying to get a figure of how.
I don't know how to answer that.
Yeah, I think depending on, like Tammy said, the needs of the individual client, there may be a roommate situation. I think we are anticipating up to 10 would be the upper capacity of that, given all the dynamics of individuals, families, couples, et cetera.
So, and I have a general question which will affect all of the projects, but since we're here, what is the contract between the individual staying there and here? So, God forbid there's an accident, what's our liability? You know, what if there's damage to the property? What if something happens? I mean, how do we, I know we're self-insured, but if somebody vandalizes or damages it because they're unhappy, I want to make sure that we're protecting the county's interests as well.
Currently, through our other housing projects, we deploy leases that our residents sign. They're held to the same standards as any other renter really would be. If there was damage to the properties that would rise to the occasion of us needing to evict, evictions happen. If criminality has occurred, we would take steps to report those appropriately. We do have funding within our Behavioral Health Services Act funds, as well as our Behavioral Health Bridge Grant Fund, that assists counties with healing or repairing slight damages or any other repairs that might occur due to the residents' actions.
Okay, and then how about the utilities? Are we paying the utilities, the power, the water, the electricity, or the sewage, if the case be?
That is all built into the operations of the property, and the client's contribution at their 30% of their income helps backfill that cost.
All right, and then my last general question is, now these are gonna be county-owned, or they are county-owned properties. Is our staff maintaining the grounds? Meaning groundskeepers are going out there mowing the lawns, doing all of that, and if so, are they in a position to absorb these new properties as we move forward?
They have been maintaining the properties up to the point of recent changes in facility management. We are back into discussions with facility management to make sure that the maintenance of those properties, including snow, would be able to be continued.
Okay, well, I guess I'm asking like the ground, who's gonna mow the lawn? Is that gonna be, are we asking that, Eric's crew to do that, or who's gonna,
Eric's crew, now that it's Eric's crew, they were the staff that were maintaining the properties prior. I do know that we've also utilized our partnership with probation when they have crews available, and they would help.
And maybe what is the reimbursement rate for that too, right? So if we're having our groundskeeper, some of them are general fund funded, I assume it's 100% basically out of the behavioral health or realignment or whatever is covering the cost of any facilities maintenance, repairs, groundskeeping, right?
Absolutely, yes.
And it is 100%?
Yes.
Direct and indirect?
I believe it happens both through monthly invoicing, and then it is settled at 887.
Okay. And with any of the properties too, I know Carl's just kind of hanging out here for a little bit. Have we ever paid, because we have some facilities that have been in behavioral health, have we ever paid general fund stuff to go? I mean, it's always come out of MHSA funds, right, for Cabrini, for Washington Street, for those. Have we ever had that where the funding wasn't reliable, sales tax went down in a recession, we had to go backfill that with general fund?
Not to my knowledge, no. I believe there may be a maintenance of effort involved in an element of the housing, but by and large, I'm not aware that general fund has had to kick in.
Okay, cool. I wanted to ask on to Carl's thing. Assume when we're doing these architectural analyses and we're looking at what to fix up, we're kind of basically front loading everything. Like the roof might have 10 years left in it, but while we have the grant money, we want to replace it so that in 10 years we don't have a liability. So you mentioned the drainage, mentioned that. What about stuff, I guess it's semi-interior, but it's not like living space improvements, but are we upgrading like electrical? Are we upgrading, the connection piping to TUD? Are we looking at any of those things too? Upgrading the water heater, doing any type of, say with ATCA, I know LIHEAP is, but while that would have existed, being able to do energy efficiency upgrades on the windows and like taking advantage of everything to kind of get it all up to as much as we can for a good shell and a good reliable utilities.
And I might jump in, Carl,
Yeah.
first. We've really tried to live within the budget of this project. So while that might be an ideal situation, I can tell you that we haven't been pushing for that. We have wanted to just do the basics, get them done, get them open so that we could have them operational. So sorry, Carl, to cut you off, but I would just wanted to add that from our perspective that has not been what we have asked them to look at.
Good to know. Carl?
Yeah, I echo that.
Carl, we can't really hear you. Something's happening.
Uh-oh.
You sound 1,000 feet away.
That's strange.
There we go. Now you're good.
Let me see. Better?
Yeah.
Okay. All right. Let me know if it's an issue. I can just go. Annie said, and that was also the direction that we got from previous staff on the project. Just working roof over the houses and being a good neighbor with fixing the drainage issues, protecting the houses. That was the direction, and with the goal of getting people in there as soon as possible.
Okay. And I selfishly want to ask just a couple really specific questions. This is on the Miners Motel, the pool. I know that I've harped on this a lot. Cool that it's there. I think we should it's parking or a garden or something like that, I just don't think that that is something we should be on the hook to maintain. So where is the status of the pool at the Miners Motel in terms of the architect?
The pool is being filled in, is the plan.
Are we, well, we have him. Oh, yeah, okay, yeah.
So if we're going to pivot to 108, we can, but the plan is that pool would be filled and not a pool.
Good. Then do we have any other, yeah, good point. I was just thinking, well, we had Carl here, but I guess we don't need Carl here necessarily for how to architect the pool out if the pool is architected out. Is architecting a verb? No?
Sure.
Did you know using a noun as a verb is called a gerund? Anyway. All right, well, I think we'll move on to the next thing. It's a real thing, yeah.
We need a drum beat for that.
Yeah. Do we need a recess after that one? Anybody? How we feeling? Okay?
Well, one last question.
Yeah.
So in your guys' timeline, I'm assuming we have to get building permits just like everyone else, or do we get to be exempt from ourselves?
No.
And have we applied and we factored that whole process into the time frame of 4 months? Because
Yeah, that's all been done. Carl, please correct me if I get this mixed up. That's all been done. We have the contractor that came in with that lowest bid ready to go. So all of that work has been done. We just need approval to approve the contract with the contractor, and that work will start immediately.
okay, so permits are pulled, issued, ready to go for whatever is getting done. Okay.
Oh, I do have one more. I'm sorry. This goes way back 4 years. I know.
Okay, I'm ready.
I believe it was Appendice X or something like that. The building, it was basically declaring that we had a housing homelessness type emergency, and it was an allowance to exempt some building codes that are traditionally accepted when it comes to types of affordable or transitional housing. We did that. We were kind of at that point talking very broadly about what projects, what's needed for housing and all that. Is that at all being applied here? Is that flexibility? The permit question kind of brought that up, where are there things that we can do which might not traditionally be allowed, but we're able to basically make something happen on a cheaper basis?
I don't know if I can speak to that. I can tell you that that's been questions I've had, like, well, could we just do this and save money?
Yeah.
But, the focus, again, is remaining within budget, making the properties safe.
Right.
For those that would maybe inhabit them. Beyond that and the historical piece, I really couldn't speak to.
Okay, perfect. All right, with that, let's move on to the next section then. Annie?
Okay, so we'll talk about 108.
Take a gerund, do you say? Yeah, let's take a 5-minute recess real quick. So we'll reconvene at 10:53-ish. All right, everybody, we're going to be calling the board meeting back. Everybody can please take seats. Got all the board members at the dais. Supervisor Kirk's online, correct? All good? All right. Could be. I appreciate that. We were having an incident happen in there. I want to thank our Access to Walmy team and the IT team for handling that. Some of it's sometimes the software not talking, sometimes outside stuff, so they're dealing with it. All right, with that, we'll bring it back to you. I think we're going to go into project specifics and just, we don't have Carl on the call anymore, correct?
I don't know that. I think
Still hanging out?
oh, great.
still here.
I hope he was still on because I feel like there might be some questions regarding 108 that he is more equipped to answer. So maybe we will focus on that and then finish up questions with Carl, and then we can let him go his way and then continue on if that works for the board.
Great.
Okay, so 108 is the other project that that we are still working towards completion. So this is obviously the Miners Motel located down in Jamestown. There's a little bit of history here in terms of the location, how many bedrooms and motel rooms were part of that original build. This was purchased again with IRF funding back in December of 2023 for $1.8 million.
And can you, what was that again?
IRF,
ERF.
I'm sorry.
Yep.
Encampment Resolution Funds, ERF. Thank you.
Mm-hmm.
And we are going to talk about ERF or IRF or encampment resolution later on in a deeper dive. But essentially the funding for that, it was a grant that we received focused mostly on abating encampments and making sure that we had permanent housing options for those that struggled with living on the street. And so the proposal that went in was to create additional transitional and permanent supporting housing options along with a few other projects. And the bulk of that really was Snell and 108 for those housing pieces. So this is an estimate of what we are looking at in terms of the total cost. I will caution the board that this is based on information and tracking that has been handed off to a few different people as changes have happened at the CAO's office, and the auditor knows that we really need to sit down and compare what we have to what he has, and so that is going to happen. I know it's a priority of his, but we've crunched the numbers multiple times based on the data that we have available, and this is kind of what we're coming up with. And so at this point in time, it is coming in right on budget. I will note that this includes the HAP Round 5, which has always been earmarked for the 108 completion. Where we're at in the process, I'll probably let Carl speak to, but those plans are either have been submitted or will be submitted to CDD any day. The construction estimate at this point in time is 1.8 for completion, and you'll see the estimates for that architectural is the remainder of Four Creek's contract. And then we estimated about 13 months of utilities and fencing. Fencing we did have to include after the fact because we were having some challenges with people accessing the site. So that was a cost that we were not anticipating, but we have budgeted in there for the future. I do have kind of a project timeline that we can talk about or ask questions with Carl, but I think I will pause there and see if Carl would like to add anything to the summary of that project.
Let me see here. I think I don't think I have anything to add at this moment. We can dive into any questions.
And I will say I fully anticipate questions about the encampment resolution grant and the expenditures and all of that. That doesn't necessarily involve Carl. So if we could focus on questions maybe specifically for him, then we could certainly dig into the rest. Not that I'm trying to get rid of you, Carl, but I know you got other places to go.
Supervisor Kirk.
Okay, if we're just talking to Carl real quick. Spent 1.8 million on it. We're gonna spend another 1.8, or yeah, whatever the amount is, 1.890 to do some construction. Are we like knocking down walls and opening things up, or are we just cleaning this thing up? Like, are we doing some major structural changes to it? Oh, you're on mute.
Yeah, let me figure it out. Can you hear me now?
There you go.
Okay, I'm not sure why. Okay, so we are, the work is limited to, in the hotel portion of the building, we need to make 2 rooms ADA accessible. And so those rooms do involve taking down some walls. They're not structural, but some of those areas need to get reconfigured. And with that more extensive demolition, there's more extensive finishes that go in those areas. The rest of the rooms are receiving kitchenettes and a new furred out wall to get services to and from the kitchenettes, water and sewer, electricity. So really trying to limit the way we touch each room as much as possible. And then in the house, there is some cleanup. So the entry deck had some unsafe framing that was identified in our site walks. And so that's some work that was not necessarily in the initial scope that we recommended the county take care of and repair. So that's in the project to replace the entry deck to the house. And then inside of the house does get a former bathroom brought back into function. So it had been sitting there, plumbing was there, not used as a bathroom, but it does need to be completely reworked. So there's some new walls around that area. And we're also bringing a washer and dryer, laundry room area up to the main floor of the house. And then there's new flooring throughout the house as well. And then the three attached units are handled similarly to the hotel rooms. So those are getting kitchenettes.
Is a kitchenette? Could you tell me what a kitchenette is, real quick, just so I'm clear?
Yeah, just a small. It's a one countertop length prefab unit. So there's a sink, countertop, 2-burner cooktop, and some cabinetry below, and a little mini fridge, all kind of in one unit.
Okay, that's my only question for Carl, but I will have some more for you, Annie.
Do we have any other Carl questions? Supervisor Holland?
So I'm assuming you guys put a bid together, or this has gone out to bid because you said it's going to be under budget. So on just a more larger breakdown of cost, like what's going to cost to add these 2 ADA rooms? What's it costing to add the kitchenettes? And my favorite subject is decks, because I know I just love decks around here. Is it going to be cost what the Cabrini deck cost, or can we get it done cheaper? Or is that even included in this whole conversation?
Yeah, so that is, so this, the project has not gone out to bid yet. Submitting for permit here any day. We're working with Annie's team there to get that submitted. And our cost estimates that we've been having put together throughout the process is where those numbers are coming from right now. We don't have that broken out into those particular pieces. But if you would like, we can do that. We can do that study of just what it costs to do the ADA rooms. Those are a requirement of the project. We can't really get around that. But the deck, yeah, we can certainly find out all the costs associated with that item itself, or any other item you'd be interested in seeing.
Well, I'm assuming you must have a engineer's estimate in an Excel spreadsheet or something like that, because you're coming up with a total cost of $1,944,000. So I'm assuming
Correct. Yeah, that came from the our construction team's cost estimate.
Okay, and so maybe Annie has that spreadsheet.
I do have it in front of me, actually.
Okay, so we'll get it from her. And then.
So we do, yeah. And when I say that we can break those items out for you, there are line items on the cost estimate. I'm sure you've seen those before. So you might see an item like rough framing, and some portion of that is going to be tied to the deck, where some of it is also going to be involved in the new walls that are getting framed in the house. So we would need to do a little work to pull those items out for you, but we can do that.
Well, it's all in the spreadsheet. I just look at it in there, because you said the deck is included in the 1.9 million, or did I miss that because you cut out?
Correct. It's just, yeah, it's in a category that also includes other items. Yeah.
Okay, and what, where do we get this scope of work? Because again, I guess I'm catching up on all of this. So the hotel was purchased basically to put people in so they're not living on the streets and they got a roof over their head, but we're adding kitchens. I mean, is this because we have the money to do it, or like what's the overall scope of why? And are we having to add like electricity lines in there because now you're adding a burner? I'm assuming it's electric, not gas. These hotel rooms were never designed with it, so now are we upgrading all the power system because now we're adding 18 stoves to the system? So are we having to upgrade the main power coming in? Like, I got some questions around that.
Correct. Yeah, I can speak to that part of it. As far as the original scope, Annie or her team might be able to speak to the source of that. But the electrical upgrades are required. So there's going to be a new transformer, new switch gear that have to get installed. And we were trying a few routes to avoid that. But ultimately, once we kind of started the applications with PG&E for the project, the initial applications, they're requiring, due to the new use for the site, that electrical does need to get upgraded.
Okay, and ran to every unit, I'm assuming, to power these ranges, whatever they are.
I'm sorry, what was that?
Okay, and so we'll be running new power to every unit?
Yes, yeah.
Okay.
Yeah.
And so did you guys receive like inspections on this place? Like, were there inspections done, roof inspections, pest inspections, pool inspection, whatever else? Or have you guys walked this place yourself, or how,
Yeah. So we have been up there a few times, and the county did have inspection reports, I believe, done during the process of purchasing the properties. And there were pest reports and roof inspection reports for both buildings. And I believe the hotel roof I believe the report said it had 20 years left in it. And so we're not touching that one. The house roof was in a bit worse shape. So that is part of the project to repair or replace the roof on the house.
Okay, I think that's my questions. Thanks.
Sure.
And I can speak to that second part of the question now, or I can save it. Okay, I'll
I
save
got
it
questions,
then.
but I'll save them just for Carl.
Okay.
Just Carl questions. Get
Carl
them off the
questions
line.
only.
Do we have any more Carl questions? All right, Supervisor Griefer.
So my understanding is that you were given direction by staff to make them individual kitchenettes in each room, and that was because that was a better option than having a communal kitchen, communal area in the house. And if we did that, then we would potentially have to have additional staff on site to manage that location. That was what your direction was given?
I think that is more of a question for Annie's team. I can just speak to my understanding of, I think it comes down to the type of housing that this is, that each unit is a little bit more self-supporting, but yeah, I think Annie would answer that.
Well, I guess my question is, you were given direction to design it a certain way, and as of now, we have not approved these designs yet. The board has not approved these designs yet.
Right.
So if we were to pivot away from that, then that money would have been lost.
When it came to the board, if it's helpful, I believe, because I had the same question, I actually preferred a communal kitchen. I bugged a lot about that. I believe what I was told, I think what was publicly presented, was it was a requirement of the grant that they had to have their own kitchenettes and it could not be congregate. And we've seen that with bathrooms and other ones too. I'm only jumping in because, again, this kind of got thrown onto Annie's plate. Annie wasn't presenting at that time for it, so.
Yeah, I would probably need to do some more research on that to answer accurately, and I'm happy to do that.
It's the only Carl question I have.
Okay. All right, seeing no more Carl questions, we'll return it back to Annie.
All right, well, thank you, Carl. I'm probably going to still have Carl questions for you, so I know where to find you. Okay.
All right, sounds good. Thanks, everybody.
Thank you.
Thank you.
So would you guys like to remain on these projects? We'll stick with that. Okay. All right. So I guess with that, I might just open it up to questions or, let me jump in. I think the biggest concern that I have as we proceed that I just want to make sure the board is very aware of, and Sarah, please jump in if I leave anything important out. And I know the board has heard some cautionary what ifs. What if we don't finish? What if we have to pivot? What if? Do we have to pay this money back? Is it going to put the county in risk in other areas? And so I want to provide kind of an update as I have it today. So again, these two projects in particular were awarded through the Encampment Resolution Fund, or IRF. That they were awarded based on a competitive process. So the state has said, if the county wishes to pivot in any way, they would have to ultimately approve that. There is a mechanism where we can submit a budget modification, and as long as that funding continues to serve the core component of encampment individuals, they would consider that. We do have, there is a part of the contract, however, that says if we do not complete these projects, we may have to pay back those funds that we have expended already, and obviously anything that has been not expended. So we would definitely need to work closely with the state if the direction from the board today or at a later date is to walk away in some way from these projects. I cannot tell you right now that if the board decides this is exactly how it would turn out. But there is some potential risks if we are not successful. I have been able to confirm that if we are in breach of contract, the county will be ineligible to apply for future rounds of ERF. which at this point in time is one of the few remaining state funds that are going to be continuing to come in for housing projects. And so, and I can tell you, and you're going to hear from other members on this panel, that there are desires to apply for IRF for the camp in particular. And so it could potentially put us in a position where we may not be eligible for that. So happy to try to field very specific questions or have our attorney speak attorney language.
Well, I think maybe framing one of the big questions that has been out there, I think the county we've not done a very good job of laying out what these projects kind of take. We brought them forward, the grant was there, and then kind of step by step did it. So it's nice to see this because a lot of what I at least hear from the public fairly unanimously is, well, you bought this, why isn't it open? Is because there are things we have to do that take time and they are somewhat sequential. So that was a question I had earlier, is if it's kind of for the architect, is it on time? Is it on budget? If not, why? If it is, maybe walking through, like, from the moment we purchased that building, like we got the grant, we have all the options, we decided to do it, whether it was the right building or not. How long would a project like this be expected to take?
I do not have that expertise. I can just tell you what the proposal has been. I would say, again, Snell is, I feel like, ready to go. I would hate to walk away from that because we are so close. I am concerned about 108, just the cost itself, and to make sure that it stays on track and on budget. I would say that if we continue down that path, if that's the board direction, and we hear that something has changed, we would need to bring that back and figure that out. The other piece I will add is that there is pending trailer bill language to extend the life of this grant. So there may be additional time to complete, not necessarily additional funding. So we would still have to work within the budget. But what you'll see in a little bit too is there is the ability to move some ERF funding from other categories towards 108 in particular if we need that. Primarily that is going to come in the category of staffing. So HHSA staffing has been was awarded a chunk of money for this project. We are not going to be able to expend it because we just don't have the staff. So we can talk about that when we get there. But again, just want to make sure that I'm sharing as much information as I can from the state, that there potentially are some risks if we do not move forward.
All right, appreciate it. Do we have any questions? You want to jump in? Do you want to go first? All right. Well, I keep calling on you every time, too. No, Supervisor Kirk. We're calling on Supervisor Kirk. You just look at me first.
There you go. Okay, I'll go through this. It's kind of the same questions, Annie, as with Snell Street. But because of what you're just discussing, I also added a few more questions to Snell Street. So we'll just jump back to Snell Street real quick. It's ERF grant. How long is that ERF grant going to be funded?
So our current grant is set to expire March of 2027. We would have to operate Snell with that encampment focus until that time.
Okay, and then there's been broader discussion in the past about how the state threw all this money out for homeless initiatives, and then they've been retreating from that and backing out. So have you seen the state change their direction with this IRF funding? It sounds like IRF funding is the only one that we're talking about. So are we concerned at all that they may pivot in the future like they have with some of the other grant funds that were discussed months ago?
Yeah, from my perspective, it seems like the IRF is the one that continues to get the most support. It's definitely a priority of the governor and his platform, and so we are not hearing that is necessarily like changing. Some of the other allocations that have been supporting our staffing piece for all this are definitely winding down, and we're not seeing that be recommended to be refunded. But IRF does not appear at risk at this time. What we're being told is that the next NOFA, or Notice of Funding Opportunity, Availability, something like that, is set to post in July with funding awarded sometime in December. That's the latest information I have about ERF.
Okay. And then if money runs out, if the IRF does run out, who's going to be will the clientele be supporting Snell Street, or is it going to come out of behavioral health fund, or is it going to come out of general fund?
That would actually be both, Supervisor Kirk. We have Behavioral Health Services Act funding that will be shifting over to the new funding categories as of July 2026. And that includes our full service partnership, which also has funding as an allowable expense. And that is both coming through the millionaire's 1% tax. It is a guaranteed funding for behavioral health services and the various components. And the only challenges is really dependent on the income of those individuals that have $1 million over. And so I would say it's would be affected by economics. Otherwise, it would be coming
So
in.
if the wheels fall off and we had to pay for it and there's no funding, it would come out of behavioral health funding?
Absolutely. And of course, the client's contribution, yes.
And then my last question for Snell is, do you guys need on-site staff required there? I don't believe you do, but I'm just confirming.
At this time, no. It's would be viewed and managed no different than our other 3 sites currently are, with a lot of staff presence on site throughout the day, but not a resident.
Okay. And then Tammy, just to help it go quicker, these can be really short to the point. So I'm just keeping an Excel spreadsheet on these, and it's helping me make my decisions. Okay, on Miners Hotel, the IRF, same thing. It's all until March 2027, correct, Annie?
Well, that is how long we would have to serve that specialized population.
Okay, so that's a good point. So and then on March 2027, we could potentially close shop. We would have done our terms of agreement with the grant.
We would not be in breach of contract at that point, is my understanding, and so we could pivot to something else.
Okay, we could pivot and sell it.
That's my understanding, yes.
Okay. And then same thing, the client, how is this going to be funded ongoing? Is this through IRF? Is this through behavioral health clients? How's it going to be funded ongoing?
So
will it eventually touch a general fund if the wheels fell off?
Yeah, we do need to have some more conversation, and that is one thing I'm going to be asking later this afternoon, for some direction on that forward thinking with that property. I can tell you right now that I'm concerned about HHSA having the infrastructure to run that. As I look at other counties across the state, it's kind of atypical for a health and human service agency to operate like a navigation center, a permanent housing program. A lot of those settings are more community-based run or faith-based. And so I can tell you that there is, I think, some interest in the community and looking at some different partnerships. I will remind the board that that was really the model way back even with Navigation Center, that went out to bid. The goal was to have that be run by a community-based organization. The feedback I have received from those that I kind of said, well, why didn't you guys apply, was that there really wasn't the funding connected to that project to make it feasible. So we may be in that position again, but I would like to explore that with some interested local organizations. I can also share that I have been in contact with the Stanislaus Regional Housing Authority, if maybe that would be a partnership through vouchers that could fund that kind of long term. Additionally, with the Veterans Administration or the VA for some HUD-VASH connections and partnerships. So to answer your question in a very long-winded way, I don't know how that is going to look. My thought is we have 13 months to potentially work that problem and get some support maybe by another organization.
Okay, and then if we move down this path and we spend 1.8 million and we fix this place up, and then now we're into 2027 and we still never even serve the population, but we've been working on it and we've got it up and running, we're good to go, no breach of contract, correct?
That's the feedback I've received, that once we are out of contract with the funding entity, then we can continue down the path where we see most appropriate.
So can we pause until 2027 until we get out of breach of contract?
What do you mean pause?
Like stop working on it?
Well, if we stopped working on it and didn't finish by the timeline, that would be breach of contract.
Okay, so they need to have it done. Okay.
We need to have the funding
Because in one
spent.
sense, we could be working on it for the next 2 years and never use it, and we just expended all that grant money and we still never use it for its intended purpose. Okay. If somebody asked this question but it was never answered, if we fix it up, when would it be operational? It sounded like there was no for sure, but do we like it? Some sort of ETA? Is it 12 months? Is it 2 years? Kind of back to my point.
The timeline that we've been given is that it would take about 12 months to complete all the construction. I mean, granted, we're not quite there yet. We still have to get the plans approved. But that we would be looking at like an end date, potential operation date of April of next year, 2026.
April 2026. Okay. And then real quick, how many bed spaces are there? Do you know?
There are, I think, around 40 that we're anticipating. So there's, I think, 16 apartments that could
That's
be.
fine. If you have a rough estimate, that's all I'm looking for.
I do have that later in the presentation.
Okay.
I just can't remember.
And then is there on staff site? Sorry. Is there staff on site required? And if so, where's that money coming from? Is that part of the ERF grant, or is that behavioral health or HHSA, or where's that coming from?
That would not be required for the grant.
Okay. Okay, thank you.
Great. I had maybe just a few small ones. One is, we've talked about this before whenever they've come up, but I just want to clarify that staff in our departments are very clear that the intent is that no general fund will go to these projects.
Correct.
It's sink or swim without general fund, even if it comes to a situation. I mean, that's from the very beginning. If something was to happen, it's like, well, it fell through. The impacts of that would be isolated to the departments or budgets that, you know, are dealing with it. I think that's always been the expectation, is we're not going to subsidize this with the general fund. Is that clear?
Yeah, I mean, I would like to kind of reflect on the path that this has happened. You know, this was not necessarily intended to fall under the HHSA umbrella.
Right.
I think I expressed to the board last time that we want to be good partners. But in terms of the original vision was that this was a different cost center. It was going to be operated as such. So that has obviously changed and morphed. So I think HHSA is, if we go down this path, we are potentially looking at an impact not only financially to us, but just workload and infrastructure. So I feel like I would be remiss not to point that out. Not that I'm saying we're not willing to figure out how to make this work.
Absolutely. Yeah.
But to answer your original question, no general fund. That has been from the very beginning the stance of the board.
And to say that it may impact what other services we can provide in terms of somebody has to work on this instead of that. Totally understood. But the general fund thing, I think, is out there a lot of what happens if it happens. I think it's always been clear and unanimous. The general fund is not really on the table. The second being that if reductions or emergency happened, there are reserves and there is the opportunity, and not that I want to use the word of it, but if we had to do some type of programmatic reduction or staff reduction to cover the cost. Again, this is an emergency falling through situation. That is an option that's on the table to ensure that we're not caught with a project that then we have to pay back money we've already spent and it's $5 million, right?
Yeah, I mean, I feel like if we see that happening, then I'm going to be coming back to your board saying we need to come up with a different strategy. If we're not able to kind of engage maybe a local organization or a group of individuals that are interested in that, and or we cannot see a clear path for funding through HHSA, I would be needing to have that conversation with the board.
Okay. And Prop 1, one of the big things, of course, right, was about half of that funding going to housing for SUD, SMI populations. Is that correct? That's a big change from Mental Health Services Act to Prop 1?
Actually, it's 30% of the total that we
Okay.
used prior to Prop 1, and 5% of that 30%
Goes to
is
state admin.
to be dedicated to persons that were involved with encampments,
Okay.
unsheltered, yes.
And so there has to be basically dedicated housing funding in behavioral health, where before it was a little more discretionary with Mental Health Services Act planning.
And we are looking at obviously other funding. We're looking at CalAIM billing potentially. We're looking at additional grants. So we're trying to, I think, strategize of how can we make this a resource in the community without it being kind of a devastating impact,
Yeah.
for lack of a better term, to the existing staff and
Right.
workload.
And I think, maybe it's a Carl question or not, some of the things that are talked about that are not the core housing thing, I mean, the roof or the electrical, or if the grant requires a kitchenette, the grant requires a kitchenette. The pool was something kind of extra asked for. The security system and fencing was something that was talked about with the neighbors. And then one other thing was I'm forgetting it. Anyway, how much are those contributing to the cost of the project? Some of these things that are not really required, but they're what we're doing for the neighbors or what we're doing for long-term maintenance.
So some of those are not being recommended. The pool, for example, is being recommended to be filled. That was recommended to be like a community garden. We can't do that within the budget.
Okay.
The fencing initially was intended to be very decorative, is my understanding. We're doing basic fencing. So again, that is how our team has approached this project. Whatever is not necessarily needed, we have opted to say no.
Okay. And then this is maybe more of a statement, but I was doing some kind of math here about the cost and, what it was on for LoopNet at one point versus what was paid for with it. I think it'd be good to kind of talk about, like, how do we negotiate with it where we don't use a realtor, we do kind of a assessment of how that's around. But 23 units, and just assuming 1-to-1, that they're not, say, in the 5-bedroom, 2-bath, multiple units, or, I don't want to say bunk beds, but two-person things. With $8.5 million up front is $80,000 per unit. At the 4.14 amount, that's about $180,000 per unit. We calculate a single-family home as having 2.2 occupants, basically, per equivalent. So 2.2 times 180 is about $396,000. So it is, if you count it to building a single-family home, on par with about the median home sale price in the county. A little more, but not at a crazy number. If you do the calculation a different way, by square foot, I think we've got it for, it's like $263 per square foot or something like that to build residential in the county. I think you probably got better data on that. But looking at that times 6,949, it's also about $1.83 million for the initial upfront price. And some of these costs are not required, like the kitchenette, except they are required, right? They're move-in ready. They wouldn't necessarily have to be done, except when we asked about that, it was, we have to do it because the grant requires it. I know when we looked at the project Home Key Grant and Silver Spur and those things, one of the issues was it said you can't use congregate restrooms. And it was too expensive to retrofit all these cabins and dorms and all of that with individual restrooms. And it was extremely frustrating because we're like, if you're in a Quonset hut type dormitory and everybody, I mean, that just, why is that not okay for some of the population? And some people are in a cabin with one, and some people are 4 units on each side sharing one bathroom. And that lack of flexibility is something that was frustrating. I maybe kind of accepted that was, after that experience, just part of this grant kind of process. So I only wanted to bring up some numbers of whether we could have had a better deal or negotiated, and maybe you have more insight into how we can do that. When it came up, the kind of price is comparable to market housing, and a lot of it is improvements to make this, obviously, that extra $2.3 million is new roof improvements. If we sold it, those would probably add value to it. So anyway, that was all of my stuff. Supervisor Holland?
Okay. I heard you say that the focus has to be on encampment housing. Can you explain that a little bit more?
Sure. So the grant itself is focused on basically addressing homeless encampments in communities. And so that was what our proposal specifically addressed. So as you see the different categories in that, that'll make sense. So when we are looking at who has to be served in these locations during the course of our grant or an agreement with the state, it is those that have a history of living in encampments.
So let's say Jaron becomes homeless tomorrow, and he comes and applies for services on Friday, but he's been living in his car for 2 days. He would not qualify, or he would qualify?
Yeah, living in your vehicle does qualify.
Okay, so it's not like living in a camp.
I mean, the overarching goal of it is to eliminate encampments. And so everything that potentially is associated with encampments can be addressed with this grant. And then whether that be parking lots with people living in it or the traditional encampments that you might think of elsewhere.
Do they have to be encampment or whatever for a period of time, or just, I don't have any,
Just
I
a
don't have
history.
a permanent address?
Yeah, a
whatever.
history of encampment or living in your vehicle.
Okay, and, okay. Trying to think what else I got for you. So, okay, so as proposed right now, and you're gonna get us that Excel spreadsheet or whatever you got with all the breakdown of all the cost, right? As is proposed right now, do we have the funds today? Or are we like, hey, we're hoping for something else, and we're hoping for a good Christmas, and maybe a bonus from Newsom, and we're gonna put it all together?
So the proposal that I have here, coupled with the calculations that we've done, again, I want to remind that that's based on tracking that has been handed over a few times. So right now, with everything I have, it's doable. I need to meet with the auditor's office to confirm that the figures I have match what the auditor's office has. But as the information I have, yes.
Doable by we have an extra 25 cents, or you have some cushion in there?
Well, I'd love a cushion. I think we'd like a cushion.
And that's the same answer for Snell Street as well?
I feel confident we have enough for Snell. Snell is much less expensive, and the figure I have for that, we would be coming in under budget by about $55,000. And that $55,000 could then go towards 108, as well as unspent funding for staffing could go towards 108. So those are all the mechanisms. We would have to get approval from the state to move that over if we wanted more of a cushion or needed more funding.
So on the grant, so they didn't just say, well, here's whatever the number was, $7 million, go solve some problems. We have to tell them, we're purchasing this, we're doing this, and we're allotting this much money, but we're like, hey, we also have this other project. Can we shift some of this over to cover this? So we don't have quite full control.
Yeah, we would have to get permission. So what you're seeing up here now is the original grant proposal by category. And so if we wanted to move amongst those, we would need to submit a request.
And I know we have one more in here to talk about. I'm assuming you might give me a different answer if we have all the funding for that one?
For
Columbia
Way is Columbia Way is not funded with ERF or IRF or encampment resolution, to get away from acronyms. Totally separate conversation.
Okay, so we'll get to there. Okay, so both projects, we have the funding. If we complete construction and somebody, I'm assuming, has to move in to satisfy the grant, at March 2027, we've met our satisfaction to the state. We wouldn't owe them anything no matter what we decide to do in March of 2027. The biggest piece is if you guys still have staff going down there to service people, about how you're funding the staff portion of it. And that's where you're like, Tammy just said, yep, it's my problem to solve. I'll solve it in my budget.
Oh, did she say that?
That's basically what I heard.
Great.
She nodded, so it sounded like that. That's
okay. Well, everybody heard her say that. No, I think it's two separate. It's, can we finish and meet the requirements of the grant, and then long term, what's the plan? I think there's two separate conversations there, but they're intertwined. I would.
Part of why I'm asking if we have a cushion there, because right now we have an engineer's estimate.
Right.
1.9 million. We might send it out to bid, and the answer might be all of a sudden 2.5, and then you're like, boat just got sunk.
Yeah, that's a possibility for sure. And at that point, we would, if the direction today is to continue moving forward with this goal, if that happens, we're coming back and we need to we'll have to have a different conversation.
Or the project has to be completely scaled back to fit the numbers.
Yeah.
And we will verify that every room has to have a kitchenette for
Yes,
sure.
we can
'Cause
look
I think
into
the more
that.
important thing is getting roofs over people's head than anything else. I would think, I mean, I haven't been in this situation in life, but I would assume that's a better alternative than.
Yeah, and I can say that, in the conversations we've had with the state, granted, it's been somewhat limited, they don't necessarily want to see us fail, right? They want to see these projects be completed and meet the need. Will there be more flexibility given? Potentially, right now they're giving me the answers that they, I think, need to give me. But if we were in a situation that was different, I don't know. We would continue those conversations.
And Supervisor, I was just looking at the time too. It's 11:45. I know we're approaching lunch, and I believe we have a lot of folks that were interested in speaking at public comment. If it's okay, I'd like to open up public comment before then.
Sure.
And I probably should have done this about 15 or 20 minutes ago, because I imagine we have a number of folks that like to speak. All right, with
all due respect, I still have a bunch of questions.
No, and we'd come back to it. It's only because if we go through this, we might end up at 12 or 12:30 and then calling lunch, and we wouldn't have public comment for folks until potentially 1:30.
And Supervisor Green, I don't know if it would be helpful at all, so you can ignore this, but I don't know how many people are here speaking directly to the camp that we haven't even talked about, or these
Right.
projects. I don't know if you could gauge that, and that would help decide the schedule, but I would throw that out as a possibility that might be why a lot of folks are here.
Yeah, and I think, it's been a very good conversation, but I think we're towards the end of what we were anticipating. And so while it's been good, we're going longer than anticipated. Can I do a show of hands real quick? How many folks have a specific concern about an individual property? Please raise your hand where you want to speak to one particular property. Okay. And can I do a show of hands for who would like to speak about, let's say, the broad program, broadly what's happening? Okay. Well, yeah, and Camp Justice, I meant to be the specific one. So who would like to speak specifically to Camp Justice? Okay. And can I also ask, how many folks are on a strict kind of timeline today? If we ended up coming to lunch and reopening public comment, would you be able to make it back? Looks like there's 2 or 3 that won't be able to. View. Okay. So with that, let's open up public comment on this item. I'm going to ask first if the folks who, if we had to take lunch, cannot come back, can line up and be the first ones to speak. We'll have another public comment for those a little later who can hang out and are planning to stay the whole time. Is that okay with everybody? Okay, good. So please line up if you'd like to speak and you got the time crunch going on.
I think I can do it in two minutes.
Thank you.
I'm Larry Brunel. I represent GSAC, Give Someone a Chance. I've been in our organization in our community for about 13 years, started by Dick and Hazel Mitchell. And during that time, we've had 78 people who are no longer homeless due to our efforts in other agencies in our community. So that's our ultimate goal, to make them productive citizens. We offer services, include our shower bus, our laundry vehicle, and a transportation vehicle. And we are coordinating with Nancy's Hope to blend our services together for improved functioning. As a member of the Tuolumne County Homelessness Committee, I have watched this process go on for a little while, and I really want to thank the board for moving ahead. After a lot of talk and nothing happening, finally something has happened specifically in Camp Justice. And we've come an awful long way. It's not perfect. We've learned a lot of things in the last year about how to make it all work, but it's been good. I also want to thank Annie and her staff and William. To make that really happen, it required them to be there almost every day. I also want to thank the Sheriff's Department, because that's been a very integral part of the success of Camp Justice. So I urge you to continue the services and expand and improve the facility because the numbers are going to go up. We know that's going to happen, and we need more space for people at Camp Justice. So homelessness is not going to go away if we close our eyes. And so I just encourage you to move ahead with that. And thank you very much for your time and consideration.
Thank you. And though I always have to be a stickler on it, because if we have any applause, we also have to allow boos, right? First expression. We try to keep it to where we allow all speakers to do it, because I don't want to have to say, don't boo anybody. It's, but don't boo anybody, so don't applaud anybody. Anyway, thank you. Come on forward. Welcome.
My name is Tom Durst. I'm in Ryan's district. I'm just speaking as a guy who likes to go and volunteer at Camp Justice, and just really appreciate the work you're doing. I know that you're really responsible for a budget, and that could be a concern for Camp Justice. But yeah, from my perspective, it's a really good thing. You're keeping some people out of shoplifting. You're keeping a lot of people out of some really severe violence problems in the unauthorized camps. In prior years, when I was meeting with people who are in like Camp Hope around there, other camps, it's just horrible things that other homeless people would do to them. And between William Vanderheiden and the sheriff's deputies, it's a lot safer. People like me, people like my wife, we can go down there. We just do simple things. We bring lunch and friendship and listen to people. And you are getting people transition to permanent situations out of there. So I really appreciate it. And just a minor thing. Last time I commented on something, it was on the navigation center. My concern was if there are a bunch of people that are just in the neighborhood for 6 months and they're walking around the neighborhood and they may or may not be on drugs, I was concerned about that. We haven't had problems. I think we do have a woman from the navigation center who does come partway into the neighborhood, and I'm hoping that a good neighbor agreement that'll be enforced so we don't have a problem like that. But thanks for your work on that, and I hope you're able to work out something for the funding.
Great, thank you.
And a great amount of appreciation for from the Sheriff's Department and William.
Thank you. Welcome.
Good morning, supervisors. My name is Catherine Hodges. As a community member here in Sonora and a community health worker, I work with some of the most marginalized members of our community across Tuolumne and Calaveras counties. I am speaking today in support of Camp Justice. The first iteration, while imperfect, has provided valuable insight, and the proposed improvements that are forthcoming directly address earlier challenges. We've already seen proof of concept. Okay, so individuals have transitioned from camp to shelter to navigation center and ultimately to stable housing. This is precisely the kind of structured and humane pathway we need. Discontinuing the camp would have real social and financial consequences. Without this site, we risk increased strain on the Sheriff's Department, emergent health services, and local hospitals, services that are already overburdened and far more costly to taxpayers than proactive solutions like this one. We have a plan. It is working, and we must stay on track with the infrastructure being built to support the most vulnerable residents of our community. Please continue your support and move forward with the improved version of this essential project, and essentially don't let the good be the enemy of the perfect. As an aside, as boots on the ground, I would invite all of the supervisors here and remote, excepting Supervisor Campbell, to really do any of the following to develop a foundational level of knowledge regarding our most vulnerable populations. Number one, attend the Committee on Homelessness. Number two, shadow, host, Homeless Operational Services Team, I believe, HHSA present here, and or ECM providers. That's me, Enhanced Care Management, as well as Lisa Silva and her team here present with Master Care. Additionally, visiting Camp Justice and or reach out to any of the agencies that are aforementioned. This has the ability to decrease unnecessary questions in order to utilize time effectively, especially when presenting on an issue of this magnitude. Thank you for your time.
Thank you. Do we have any other time sensitive? So if we, again, go to lunch, we're coming back 1 or 1:30, you're not able to make it, but you want to be able to speak. Any other individuals there? Okay. We can return it back to the board, as I mentioned. If we end up doing that and you're back, We will reopen public comment for a second round after we've completed all of the sites. Just a time note for the board, it is 11:55, so if we're looking at 12 o'clock, Sarah Griefer, your comments, and we can either do 12 or go to 12:30, and however feels good, but
Thank you.
Mike's yours.
I couldn't hit 12, so if you want to take a break and then start up when I get back, or start up when we get back, I can do that. If you want to go to 12:30, I'll leave it up to the board.
Begin with your comments or questions, or we can go to the next one. We do have a engagement with a community organization that was scheduled with that. Let me see. Well, Tom, because you need to be there too.
That's done it.
Oh, okay. Okay, good to know. Then we are fine on time. So let's go to, what do you think? Let's recess until 1 p.m. then, and we'll be back. All right, everybody, it's 1:15. We're going to reconvene the Board of Supervisors meeting. Thank you, everybody, for your patience. I believe we're moving on in the presentation. So, Annie, back to you.
All right, so I'll do a little check-in. We can continue to talk about the 108 property, IRF. I think the hope is that at the end of all this, we can kind of have a conversation about staff direction and board direction. We could also now pivot to Camp Justice. We have some specific slides to that, so I'll look to your board for where you'd like to go next.
If there's no opposition, I would recommend that we move to Camp Justice. Yes. Supervisor?
I didn't have any of my questions. I didn't get an opportunity to ask, so let me fire off a couple.
Yes, that's correct. Thank you.
Yeah,
Yeah,
no worries.
we'll let you be able to do that, and
So
then
food
afterwards.
comas, kick it in.
Yeah.
All right. So, can we go back to the timeline, please?
You'd think I'd know the order of these by now. This one.
There we go. So we purchased this property in December of 23.
Correct.
And so that address is, or that date is correct, that November 4th, 2024, 11 months later is when we did a walkthrough?
That was when the architectural group walked through the property.
Okay. Because it just seems odd that it would sit for almost a year before we really did anything. Now, I know in December of 23, we purchased it in the first part of December 23, and then December 22nd of 2023, there was a walkthrough regarding, what needed to be fixed. And then in January of 2024, there was a roof, inspection done. I'm just concerned that we have to have this building open and operational. And I know that that's still kind of a vague, nebulous, what is operational, by June of 27.
Correct. Well, we have to have the funding and project completed by then, yeah.
And so are we going to be able to hit those dates? Are we going to be able to have that operational, ready to go? My biggest concern is that we're going to have to either pay this money back or we're going to have to do something. And for me, I'm at the point where I would rather save the money we have instead of continue to spend on architects and all this other stuff. If we could move some of that money to fund Camp Justice for a couple of years, move that money to do something else without violating. I'm really concerned that this is going to be on our books and it's just going to become this albatross and we're never going to get out from under it.
Yeah, so your board has the ability to direct us to, again, work with the state to submit a modification to our plan. That would ultimately have to be approved if we were to move funding in between the projects, but we could do that. Okay. Or we could request that, I should say.
Okay, and I know this is before your time, so as I said, I kind of expect some I don't know answers or I don't want to answer.
Oh, is that an option?
It's the 5th, you can do that. But I'm still trying to determine how we got to $1.8 million for this piece of property. It was listed at 2.1. Somehow we got 1.8. I can't find any documentations where that was a fair value to that. And again, I know that was before your time. I know that there was no inspection done on it. No, I'm just curious, is that common practice for all of these properties? Is that we just kind of buy them as is and we kind of move forward? Because if so, then we really kind of should change our business model.
I don't know if I can answer that. There were inspections done. I think maybe you're asking like appraisal. Is that
Well, I know there was no appraisal done specifically on this building. And, and going back to So I know there was no appraisal done. I don't know if there was an inspection done prior to purchasing this.
See what you're saying.
So I know that there was an inspection done, kind of a work order inspection was done in, 25 days after we purchased it. So I was just wondering if all of that was considered when we went into the money decisions of this, because on April 8th, when you came before us last time, you provided this documentation that says, for the grant amount, we have $3.2 million. We've already expended 1.76 for the two buildings on that property. That leaves us 1.4. And then we came in with 1.8 for the repairs now, which is going to be another 10% on top of that, just because of the way life is. So we're already in a shortfall, and I'm really concerned that we're going to be taking from Peter to pay Paul for a project that might not benefit us down the road.
And I think I do have a slide that will address that. And I'm sorry, I'm flipping back and forth so much with this. Is this what you're referring to in terms of so this is an updated chart, probably similar to what we provided in April?
Yeah, it's close enough.
So this is, what you'll see on the left column there is the actual original budgeted amount for the project. So for 108, if we look at both the home and the motel component, that was 3.7 million with the additional HAP round 5 of 394. So that is the funding that we have allocated or planned for the full scope of that project. Does that answer your question? And so if you stick with me here, this is what we are coming up with what that final number would calculate out to for completion of 108.
As is now, but we don't have a quote on the work that's going to be done. They're still working on the engineering or on the architecture.
It's on an estimate at this point, yeah.
Right, so we could shoot way past that if the roof needs to be completely ripped off and put back on, or the deck needs to be completely destroyed and rebuilt. My questions are, is each room going to have its own water heater, to service just that? And if so, I know there's a line item for plumbing, things like that. So I'm just concerned that, any house project, we've all owned homes or had projects, it goes deeper. There's that mission creep. It just keeps going and going and going. And I'm just concerned that we're going to run out of money before we hit the date, and then we're not going to be able to get it open. We're not going to satisfy the loan or the grant, and then government's going to say, hey, give us the money back.
So there's a lot packed into that.
Yep.
So I'll try to chunk it out. Again, let me back up. Would I like to see that cushion of that 7,000 remaining be higher? Absolutely. As mentioned earlier, the hope is that the auditor's office can give us the hard numbers accurate so that we truly, truly know what we're working with. In anticipation of, again, not having a ton of wiggle room there, we have looked at other categories within IRF of what we could move around. You'll notice that the staffing in particular is still relatively high. And so in theory, the board could say, work with the state, request a modification to move that funding towards Highway 108. And so we would be looking at those sort of options if that number is not in that place where we need it to be.
So what would worst case scenario be? Worst case scenario is that they say no, right? No, you can't do this. No, you can't do that. We're not going to approve this, and now we're stuck, right? We're at a fork in the road. Either we don't have enough money to finish this off, and then we get dinged for it, or we take from Peter to pay Paul, and now we're possibly cutting into services from another program in another area for this. So the reason we're here is because I raised this entire question way back in the beginning of the year when I was specifically told by a staff member that there's no way we're going to hit this target. Now, maybe that was just sour grapes, and they were just, saying this is no way. But at that point, for me, being, responsible for our budget, along with my colleagues, I can't continue to pay into something that I'm not going to see that return on of, getting that building open, providing those services, if indeed there is that potential that we could be on the hook for this money.
Yeah, I think a couple things there. Again, there is the potential that the timeline will be extended with the trailer bill language, so that would certainly be helpful. And then I'll reiterate that, again, the strategy we've had is to really scale back some of those projects or components of the project that maybe were going to be taking longer to complete, and so that we could really remain on target. Four Creeks is telling us that because of that direction, that it will go faster, right? If we're doing less, then it will go faster.
And you kind of touched on the point we talked about offline is the pool. I believe Supervisor Brandon asked you about filling in the pool and putting in a garden, and your answer was no, but I think what you meant to say was we're filling in the pool, we're just not putting a garden in. So we could reach out to a nonprofit to put in a garden or something. We could work with our nonprofit organizations, service organizations. And then the second thing was the wrought iron fence. You said that we're not going to be able to do that. We'll put in a different type of fence. I just want to make sure that we're also being good neighbors to our community members, the people that live around that area as well. And lastly, and I'm sure Supervisor Randall will echo this 100%, is as people drive up that highway, we want to make sure that it's not an eyesore. As people are coming into our community and they go, man, this place is East Palo Alto in 1990, and we don't want, no offense to East Palo Alto.
It's very specific.
Yeah.
Sounds like there's a story there.
I graduated high school in '89. I was told not to go where to go. So anyway, my point being is that I think we want to make sure that, and I'm not doubting you and I know you inherited this, and I want to say on a side note that I appreciate everything you and your team have done. I know that you have been working around the clock to answer everybody's questions, so I do sincerely appreciate it. I don't want to forget to tell you that and your staff, but I want to make sure that when we make a decision as a board, that we're doing everything we can to make sure that it's in the best interest of this community and our county. Thank you.
Okay. If it, I guess, pleases the board and continue with the other projects, I would recommend we go to Camp Justice and go through all of these. And then I'd like to, after we've had all of the presentations and kind of questions on these items, then open up public comment for everybody. Now then having everything, we'll bring it back for the kind of final discussion on anything. Does that sound fine? Either way. I would just, I mean, what would you prefer?
I would prefer Camp Justice.
Okay.
Okay. So we will pivot to Camp Justice. Before I do that, I do want to just kind of set the stage a little bit. Again, Camp Justice was funded through the ERF, or Encampment Resolution Fund grant. The intent, again, was to really target those encampment areas that were problematic within the community. And so I did feel it was appropriate to try to show some of the progress we've had in this. So thank you to our partners at CDD that shared some of these photos. Essentially, they're just before and after pictures of some of the areas that have been addressed through the work. So you have Burgle Road here. Here is Racetrack Road. Camp Iron Horse. The Rawhide Bridge. And Camp Hope. So some pretty dramatic improvements in some of those areas. Next, I'm going to kick it over to William to talk a little bit about Camp Justice.
Hello, I've had the privilege and challenge of managing Camp Justice since it opened July 2nd. It's been a challenging project, and the board direction was minimal management at the site, and we identified early on that that just wasn't going to work. So we've managed it as minimally as we could, which was quite a bit more than was originally intended, I would say. We've served quite a few people, and we've made a lot of progress. I think it's 158 people served so far officially, but that number would be a lot higher for people who haven't officially signed the rules or haven't been there when we're there or are a little bit more flighty or transitory. So we've served quite a few people. Originally, it was thought that it wouldn't be well utilized and a lot of people wouldn't want to be there, but that's not what we've seen. We've seen it's quite popular. And we currently have 16 trailers and one open trailer spot, and the 17th trailer will be moving in today. There's about 50, low 50s is the population right now. And as you can see on the board there, those are the numbers that were given to us by the Sheriff's Office of a 1-year snapshot of their calls for service. So I think you see a lot on, the scanner apps and chit chat that the Sheriff's Office is there, and that goes into those 300 CAD incidents. But a lot of those are just patrol checks and just them out there doing outreach and just engaging with unsheltered folks. And so Sergeant Benson and Deputy Hoffman and the whole Sheriff's Office has been fantastic partners out there, along with behavioral health, public health, Cal AIM, all the people, Master Care, Adventist Health, ATCA, the host team, just everybody that goes into making it work out there has been really appreciated. And you can see with the 300 CAD calls, there's only 22 disturbances, which I think is fantastic in a 1-year span. So I'll just kind of go from there. I could talk about Camp Justice all day, but.
Just to clarify a stat, because we did have the establishment of the bailiffs program, right? Being able to, from the court property, do security. So when it's basically a CAD kind of incident dispatch going in, and it's got the 300 number, what is that? Is that when they've gone through, my understanding is they go through and check multiple times a day? Is that an actual incident or, just an interaction? And Sheriff, thank you for being here all day for us, be able to help talk about this issue. Appreciate it.
Of course, it's a worthy cause. Dave Vasquez, Sheriff of Tuolumne County. Clarification on CAD incidences, that number 300 is indicative of all emergency services that reports through our dispatch center. It could be probation that's going to look for somebody that might be within their purview, ambulance calls for service, and also patrol checks, and in fact, maybe a crime in process or whatever the case may be. So it's a culmination of all those incidences collectively.
Okay, and adding up all the other ones, I just mean, is there a lot of those that may be innocuous, or are they all at some level of like medical incident, something of a serious nature?
Serious is an interesting, I'll say that they're all serious if they require an emergency response. So if an ambulance is going there, I'd consider it serious. If the deputy sheriffs are there, I would consider it somewhat serious, and to the varying degrees, it could be really in the eyes of the beholder. I don't want to speak to every incident because I'm not familiar with all of them, but I would say typically what you have is that could also be a call for service that was generated from another person who is in fact living at Camp Justice as well. So there are inter-camp reports that are taking place, a combination of all of those things.
Copy that. Thank you.
You bet.
So one thing we've really tried to do is just limit the impact this community is having on emergency services, whether they be ambulance services, the emergency room, the sheriff's office, the fire department. And that's just us getting out there, being proactive, addressing those things, firsthand. And things that would normally unsheltered people might call an ambulance for or might end up in the ER, we're just really promoting getting a primary care and going to the Matheson walk-in instead, and just kind of helping our emergency services service true emergencies. So that's been a big goal of ours, and I think it's been a successful one.
So what you see here, and William might jump back in, I think it was mentioned a lot of lessons learned in the first year of operation. Some of the things that we have had to figure out is, again, the utilization of the site has been quite large. So we have had to bring in additional porta potties that we didn't plan for initially. And we've had, as you can see here, a big utilization of RV spots. So initially, when the site was operational, we had 9 dedicated spots. And as you heard William say, we're well over that with our RVs. So we've had extremely fortunate partnerships with the Sheriff's Office. And we have really tried to figure out how to kind of keep the site safe and operating well. And so this was a picture from maybe a few months ago. And you could see that we were we had a lot of overflow RVs. We had people kind of leaving the intended footprint. And so some work was done to try to restructure a little bit. And so this is kind of how that transpired. So you can see that overflow area is now clear. And then the tents and the RVs are kind of intermingled. Additionally, we started by closing the camp once a week for cleaning. We received a lot of pushback for that. And so we worked really hard to try to say, how could we kind of meet a happy medium here? And so right now, at minimum, the site is closed once a month for cleaning, but not for weekly cleaning. Any other big changes, William, that I'm forgetting?
We have made some modifications to the rules. I don't know if we want to address that right now, but we had some initial rules that were developed and planned out, and we've kind of, as we've learned and gone along, there's been some we've taken out, some we've modified, some we've added, and that was with a heavy input from the Sheriff's Office, from the Homeless Services Commission, And with some breakout work groups, we've developed kind of some new rules that we think will help us going forward. And just, one of the things that I do regularly with the sheriff's office is just try to bring some order to the chaos. I've worked in homeless encampments for the past 15 years in different counties, and they can be chaotic places, but we just try to eliminate that as much as possible. And so the sheriff going out there and saying, I don't like where that tent is, if my officers have to respond to it, not the sheriff personally, but the sergeant or the deputy, I don't like my guys having to respond to that. Let's bring them up closer. Let's move them in. We always take those recommendations. I don't like where that vehicle's parked. A fire engine couldn't get through here. Boom, that vehicle's moved. So I just think that's a big part of the goal, is just bringing some order to the chaos which surrounds that population and that encampments in general.
Okay. Oh, yeah, I think
And
we have a
Supervisor
question.
Kirk has his hand up.
Hey, thank you. Don't take this the wrong way, because it might sound, well, there's gonna be lots of opinions, but I was pretty clear when Camp Justice started that, and I was told, and it was confirmed several times, that those folks would have to move off the site once or twice a week for cleaning. And it wasn't just because of cleaning, it was because it was very clear from this board that we did not want to make this a comfortable space for them to reside. And so when I'm being told that they only have to remove themselves from that area once a month, that deters 90% of them wanting to get services and not having to move. I'm looking at the total served and the total who exited to housing. Maybe that's part of the reason why, is because they're comfortable there. So why would, at least for me, and I thought the majority of the board agreed, I know half did, I'm thinking some others did, but we made it very clear, we don't want this to be comfortable. We want them to move off twice a week. And if you do that to somebody, they get tired of moving, and they either get into services, or they move on and they exit our community. So I'm really frustrated that I'm hearing that they're getting moved off once a month. So I need to understand why I thought we gave clear direction on that. It's changed.
Yeah, I can speak to that. So, like I said, we did hear quite a bit of feedback that was not feasible, that it was, a full day of work for many people to do the weekly move outs. And then William worked really hard, I think, with the participants of the camp to say, hey, look, like, if you can agree to kind of pull your weight here and keep this place clean and do what you need to do, we might have some flexibility there. So that really was a strategy we utilized. And I can tell you that one of the proposed new rules is that if people are refusing to engage in services, then they cannot stay there. So that is a proposal that we are seeking board approval to move forward with. To that point, that the goal of all of this is to get people in services and in housing. And so how can we structure the program to have the best results in that area? And so that is a moving forward direction we'd like to go.
How long do they have to get into services before they're released from that area?
The proposal that has come forth through the committee is 90 days.
90 days. Okay, and that's just a proposal? When does that need to be adopted?
Well, that is what we'd like to hear from you guys today, if you're in support of that change.
Okay, I mean, right off the bat, I'd say you get in services within 30 days or you're out. I get some of the logistic things, but I'm telling you guys, from 18 years in law enforcement and 19 years in law enforcement, and 18 of which have been in a prison. And I'm not trying to say that someone who's homeless is any way comparable to an inmate, but there's a very simple, logical understanding that if you, as an inmate, if I have to give you a bed move because you're not following the rules, that inmate will immediately change his behavior within a couple bed moves, because they're tired of picking their property up, moving to another location, picking up their property, moving to another location. So that was why I was so hell-bent on making sure that you either get in services, or it's going to be annoying. You'll get so annoyed that you're going to want to move out. So it's frustrating that I was very clear about that. Other board members were. And I think that's represented in how many people have not exited, have not gotten services. So for me, this is like the best program we have, but it could have done completely better in my opinion. So if you want my support on this moving forward, we got to immediately correct that or make that 90-day window like a 30-day window, because I don't want to turn this into, sunshine and flowers. Like, this is supposed to just be the stopgap for treatment. This isn't going to be permanent camping. So I'm going to be really clear on that. I'm disappointed that took place, but I'm willing to course correct today, and we got to fix that.
Okay, great. And with that, so we mentioned about the project presentations and doing public comment. Did we want to divide this up by project? I think you had mentioned that maybe.
Supervisor Brandon, we do have a few more specifically from the homeless committee that would like to speak on Camp Justice.
Okay, great. Great.
All right, so this is really the presentation on Camp Justice in more detail here. Given a lack of time, I think let's skip this slide. And I'll just note that we have a strategic planning sub-team that you can see the attendees on that. And then we'll have a broader Camp Justice work group that's incorporating the learnings from the current state of the camp and looking forward into the next version of the camp. And we're going to go into the details of what that is. And these are the people that are involved in that exercise. Let's move on. So the really important starting point is having guiding principles. And this really gets back to a lot of the conversation I'm hearing with the board here today, which is, what are the policies that drive the processes we put in place, the actions that we're taking, and then the spending that we intend to advocate for. It needs to begin right at the top with our laws and regulations, and recognizing that all those and local ordinances, they apply to everyone equally, everyone that resides in Tuolumne County, are housed and unhoused. We all operate under the same laws, rules, and that we're not suggesting that we create a separate set of rules for our unhoused community that we're trying to take care of. That's all, just to make that really clear. We began with that expectation. And these are all guiding principles that we want your input on as to whether you agree that these are the appropriate guiding principles, and if you want to adjust the language. This is just what we're currently operating with, and we're looking for your input. That services and shelter solutions are limited, and therefore we have to prioritize who's going to be served. We're going to, this is unfortunate, but we don't have an endless supply of resources, human or dollars, that can be applied. So we want to serve those individuals that are with services that are focused on the root causes. So we want to address substance abuse, severe mental health conditions, and the life skills development towards having an individual become self-sufficient and stable and exiting, as quickly as possible, knowing that that's complicated, difficult, and very individually assigned amounts of time that are going to be required there. We're also recognizing that shelter is a core component of the safety and therefore of recovery. And this is why the state of California has been so focused on housing first for all these years and pouring billions of dollars into beds. And what we're suggesting is that it's not that that's not important. It's just that we're looking for a different balance here. We want to see more dollars go towards casework and go towards the recovery of individuals. That we're striving to address the needs of as many individuals as possible who meet the local requirements. So that needs to be further vetted out, but our focus is on those that are unhoused in our community, that come from our community, that are part of our community, that have family members here, friends here, they've lived here for 5-10 years. They're part of the community. They encountered a difficult patch in their lives, and they've fallen into homelessness or into all the things that drive homelessness, that create homeless conditions. So it's really a point of prioritization, not excluding others. It's just saying that should probably be where we focus the bulk of our efforts. And that we deliver services with the highest level of efficiency. That really kind of speaks to the dollars and the staff time and how that's assigned, and the suitability and compassion for these folks whose level of functioning can really be seriously limited for maybe short periods of time, and there's a growth path out of that, hopefully. Let's go to the next slide. And we can come back to those later if you want to, if that's important to you. This pictorial is illustrating what the current Camp Justice looks like and how it functions from a process standpoint. It begins in that lower left-hand corner where we're encouraging and or extracting people out of the wild. And today, without Camp Justice, they would go straight up that one line that goes to justice involved, or they may find themselves with behavioral health, or they may find themselves with ATCA and other partners in our community-based organizations. And what we've added with Camp Justice is a intermediate step, an alternative that gets them into a sanitary, safe, secure location where services can be brought to bear on a regular basis. And it's much more efficient if we can operate that way. I think everything you're going to hear from everyone else is about how that's improved the situation for not only for those that are being served, but for those that serve this community. We've also, the picture illustrates the positioning of the Navigation Center and Health and Human Services. Like we have the Snell Street up there, considering that we're getting close to being able to utilize that. So it has a date on it. It's proposed. It's not in place at the moment. But the goal is to exit to market rate housing. So we all have the same goal: help folks get recovered to the point where they can secure a job, and maybe with that, along with subsidies that come from the federal government through the state and local, so on, can get to market rate housing. And in the lower right-hand corner, it says, encouraging reunification with family and friends, that the participants may find solutions outside of Tuolumne County. I mean, this is a great place to live, but let's face it, it's 4 seasons. And it may not actually be the best place to be homeless, particularly if you have options elsewhere. So we're not the intent is to have people served in this space for the shortest period of time possible based on the individual's needs, and then move them on. And that's what we want to be able to do in a more effective way. I also have up there that we have an HHSA, behavioral health, CBO. It's kind of hard to read even from here, and faith-based organizations. But the objectives is serving participants is significantly more efficient with this consolidated location with Camp Justice. It's more efficient for our law enforcement. It's more efficient for all of our service agencies and for both private and public participation in this space. Is more efficient. So that's okay. Let's go to the next slide. So I'm going to pause on the pictorial because it's these recommended program changes that are driving our vision for Camp Justice 2.0 that we want to ask for your input on. So I'm going to pass the mic back over to William to cover those slides.
Okay, sure. So the main recommended program changes is a maximum stay of 90 days for those that fail or refuse to engage in services. And it's kind of an interesting question is what does that look like? Because currently we're not providing intensive case management to the people at the camp. So when we look at why is there 40 people that have exited to permanent housing out of 150, maybe that's not a great percentage. We're not intensively case managing those people. Those are CBOs, they're individuals that are working with people. So that's kind of what Camp Justice does, is it allows those other groups and individuals to come in and work with this population. We've not been case managing them heavily. The only place we're really able to provide that intensive case management is the Navigation Center, where right now our successful exiting rate is at 80% from that program. So that's really the difference in why the facilities are so important. But under 2.0, we would bring more case management of some sort in, obviously, if we're requiring that they engage in services. So we still need to figure out exactly what that looks like and how we do it, but I'll just throw that out there. So engagement in services will vary depending on individual needs, and HHSA will make individualized determinations because we're not the only people doing this. There's a lot of people doing great work, and if you're engaging with them towards a sustainable lifestyle, that's good in our book, and it takes a little pressure off of us to case manage every single person out there because it's very difficult with our limited staff. So if you do get exited from the camp for lack of engagement, you have to be gone for a period of 90 days, which was a suggestion from the sheriff's office as kind of a cool-off period. Go back out into the wild, to use Tom's term, for 90 days and realize how good you had it at Camp Justice and come back with a fresh attitude and ready to engage in services. And then just from feedback from the community, just the quiet hours of not allowing generators at nighttime. And then from the sheriff's office and from code compliance, one recommendation is to make camping out of bounds grounds for trespassing from the site, just to try to maintain the integrity of the original footprint.
Let's go back to one slide for a second. You'll see from the Camp Justice in the current state process here that the exit from Camp Justice is to a CBO shelter. So in the current model, we don't have people going from Camp Justice to the Navigation Center. That's not happening. There's another step going into a shelter and then into services and then into the Navigation Center. I just wanted to point that out for clarity. Okay, Annie, if we could go to the next one. Okay, it's a bit more complicated here, but this integrates all of our learnings. You'll see that the change here is that in Camp Justice, let me back up and just say that there were actually two initiatives that we took on as a committee a year ago, 2 years ago. One was to do a tent camping site, and the other was to have a sanctioned automobile or sanctioned parking, essentially, and we really didn't so much address the RVs. We were just really kind of thinking about people who are living in their cars or a truck or a van or something like that. But what happened was that, as you see in the previous photos, we just got inundated with trailers and RVs and mixed in with tents. And so it actually created an interesting social dynamic, which is that you had the tent people and then you had the trailered and RV people. And those are two very different living conditions and created some problems for folks. So that was one learning. Secondly, to try to address this stronger encouragement towards getting under case management and making progress and exiting the Camp Justice, what we are proposing is that we would create two environments inside Camp Justice. One would be an intake site, and the other one we would call a program site. So in the intake site, these are folks that are arriving either on their own or they have been encouraged to be there or they're being taken there for whatever reasons, and they would be in a tent site and sort of adjusting back to maybe being in a more structured environment. But as quickly as possible, we would want to move them into the program site. And these are people who are on board with their program, their recovery program. This is a much more heavily case managed function, so that there would be those two steps. And then because we could do that, we could go directly from Camp Justice to potentially to the Navigation Center, and then to these other, not shelter, but supportive housing, transitional housing solutions that we have up there that we're going to talk about more in detail. Okay, so the enhancements that we're looking for in 2.0 is to get people up off the dirt. So there's these plastic pallets that can be bolted together, and we can make them any size. But what we're talking about doing is creating level palleted locations for people to pitch their own tents on in that intake center. Now, if they don't have a tent, we could provide them with one, but it would be a small, camping tent, and pretty much what they would have had out in the wild. And so that would be a community in and of itself in one part of the Camp Justice area, and then they could engage in a program. They could transition to that program site, which would be much larger, heavier duty tents. I mean, these the ones I'm looking at right now, they're suitable for actually being used in snow. So these are substantial. We would include, cot and other things, but they would be able to reside in those kinds of spaces because they are definitely in a program and working towards the goal of exiting Camp Justice as soon as possible, getting them to the state where they could go into the navigation center and some of these other facilities. The other big difference that you can see here is that we've removed the sanctioned automobile parking and RVs from this. So we need a different solution for those two things, and the team needs more time to go sort out what that would look like and how that could be managed. A difference between Camp Justice 2.0 and these other two sanctioned automobile and RV locations is that for 2.0, the cost is so low at approximately less than $2 a night for it to cost us to operate having them be there. A little bit higher with the program tents that might be in the range of like $4 a night or something like that. We have to do some more calculation around that. But significantly less than the $21 a night that it costs us collectively for them to be in CBO shelters and similar shelters. Significantly less than what it costs to operate the navigation center on a per bed basis. And at, the numbers are up in the left-hand corner for you to look at that. But, the hotel stays are in the $120 a night category. So we're talking about being able to serve 50 or perhaps more people in Camp Justice as they transition through at a very low cost structure if we go with these, tent and pallet solutions, and then they're encouraged to move on from there. Whereas the sanctioned parking and the RV site might be one of those situations where we could ask the partner, the participant, to actually pay. So it would be more like a KOA style environment in terms of its attributes. You'd have individual hookups for water, power, and sewer and all that kind of stuff. So, I mean, that just takes a lot more investigation on the part of the team to figure out what we could do. Ideally, it would be a community-based organization, an NGO or something that could set that up and operate that. But that's down the road. Okay, let's go to the next slide. And that's back to you, Annie.
So these are the specific recommendations from the committee, I believe, Tom, right? So I will kind of go through these, and then I will kind of pivot to what our staff would be looking for direction today. So the committee, who I think everyone's aware, his job is to provide recommendations to this board, is that they certainly would like to extend the pilot program beyond July, pending funding. That the new program rules would be implemented, that they would like us to continue to look for additional funding to continue operations, work towards that solution for the vehicles, and then continue to kind of develop this, 2.0 vision of what this could look like in the future. So those are the committee recommendations. What we would be looking to you from the board is to weigh in on some of that, or all of it. So the questions that we really have for you guys is, do we want to continue the camp past that 1 year mark, depending on the funding that we can find or move to support that. Is there support for the new rules and guidelines? There is a question that I think we need to have some direction on, is whether or not we want to pivot towards finding a different location for the vehicles and RVs and really transition Camp Justice to tent only. We'd like some feedback on that. Again, would you like us to continue looking for funding to maintain and or improve the camp? And then as we think, future down the road, Tom kind of touched on this, but if the direction is to make Camp Justice bigger, more extensive, and require that case management site, the case management piece, then we would need to really look at how that would look, if that could be done by a CBO, what that management of the site would look like. I think if it did expand, then that is a critical component that at this point, our staff obviously does not have the capacity to do. So that was a lot, but that's essentially for Camp Justice what we're looking for direction on today.
Great. And I believe, thank you for the presentation. We have, from the hands earlier, a number of folks that want to speak. We did discuss the Snell property and have that kind of tabled for the contract in action. We did discuss minors, similarly, not giving direction yet. My recommendation would be we pause on this and do that at the end. And we're able to do that after we receive public comment, so we're not giving direction and then getting comment. Is that fine with the board? Supervisor Campbell?
I'm a little slow on the uptake, so you're saying...
We do direction for all the sites at the end.
Including Camp Justice?
Including Camp Justice, so we can have public comment before we give official recommendations.
Okay.
Right now, we haven't had, for most of the folks in the audience, public comment.
So you're suggesting we do public comment now?
No, we continue with the... what we have left, the Columbia Way project, and then I think Snell is also on here. And we would finish up the presentations on these, then do public comment, and then bring it back for discussion and direction. We did the contract.
No, we did so I think what you're trying to say is, so here's my here's what I suggest. We have a lot of people here. Why don't we take public comment for Camp Justice now, then we can give direction on Camp Justice. Those individuals who wish to leave, they can. Then we can go revisit the Snell property, give direction on what we want to do on that. Then we can revisit the Miners Motel, give direction on that. Then we can have Columbia, be done with it, and Bob's your uncle.
If the board's okay with that, I'm open with having public comment on each of those and just reopening it. That's fine.
Well, and I really want to say I'm grateful, Supervisor Brandon, that you're working through this and trying to organize, because it is kind of difficult. I would say Camp Justice is a very different discussion than some of these other things we're dealing with. So, and given, I think, the level of public interest in people that are here, I'm not sure if that was your suggestion, but I would all agree that we should maybe take that separately. And
I'm hearing agreement and consensus on that then, right?
I kind of see the properties discussion as more joint, more self-contained, and then the Camp Justice discussion.
You guys want to do Camp Justice to wrap this up and then do the other ones?
Yeah.
Because this one's more of a social as well as an administrative, and I think the other ones are more of an administrative nature.
Now, to clarify with legal counsel, if we open up, because this is all one item, if we open up public comment, we can request gently that it might be about this topic. But if someone comes up to speak about Camp Justice in that section, but then wants to speak later, we're going to have to allow people to break or violate the rule or suspend it, that you can only speak once per item. So just so we know that
they'll be able to
then an
speak
individual
about
may
other
be able to
items.
speak 3 minutes on this and 3 minutes on every time we do it. Is that fine?
Yes, ma'am. Sure.
Okay, so with that,
Excuse me, I just wanted to clarify that if you have additional questions about our vision for 2.0, we have like financial estimates and some other logistical components like fencing and all those kinds of things, but I was waiting for those to come up as questions, but we were prepared to answer those.
I'd like to open public comments specific for the justice item, and then we can do discussion. Is that fine?
I was going to ask, can we ask questions first on the?
Yeah, we can do
justice
questions
center?
first.
Okay.
It'd be fine. Supervisor Campbell, you want to lead off?
Yeah, I did. Well, you were going to speak to one of the items, so fencing and kind of the surrounding footprint of the area has been brought up. Do you have any recommendations, or was there any feedback from the?
Yes, we do. So William's been very instrumental in describing operationally some of the challenges that we've had with the space. And so one of them is that because of the topology, and that it drops off sharply in some areas, we want to contain the camp in a sensible way so that there's good visibility. It's easier for Sergeant Benson and the Sheriff's Department or whoever else might be involved in law enforcement to be able to deal with the site safely at night as well. And so the recommendation is that we invest in a privacy fence that goes around the campsite. So that gives the participants some privacy. It also establishes a barrier. So these are the behaviors that are required in the camp, and you're in the camp. And you're in the camp because you're on the right side of the correct side of the fence. So I think that's really an important investment to consider, and we can talk about the costs involved in that.
Well, then that was going to be my next question. So would that be ERF or HAP or?
Yeah, those would be those would be contained within the ERF budget, depending on what your decisions are about these other elements, right? Or we could look for additional grants. And/or there may be some outreach into the community for support. But we have to talk about if we make investments on county property, what kind of investments can be made by the public or however that might work. So there's a lot of details to work in that regard. But there's some other logistical learnings that have to do with cooking and fire, open fire. And William and I and others have assessed that situation and some solutions around that. That would require some investment as well, minimal, but some. Another overarching part of Camp Justice is that it is actually placed on county property that's designated as a road that would be connected to Sanguinetti in the far future. So any kind of any kind of investments that we make, we want to make sure that they're mobile. They're not permanent changes. We're in discussion. One permanent change that has been made is we now have TUD water there. But where the dumpsters are located works out great, and that's mobile. If we're going to encourage more case management, it would be helpful to have an actual enclosed office, air-conditioned office kind of an arrangement. So one of the things that we're envisioning is being able to get one of the modified shipping trailer solutions that contractors use that are already converted into office and storage space. We have lockable space and a place for staff, there are solutions for how we could power that and make that even off-grid, but still usable. So there might be some investments that could be made along those lines that are pretty minimal, but also a cooking area with integrated washing capability to help with sanitary issues. So those are on the list. Those are in our vision, and we have some rough numbers around them if you're interested in those. These are not large expenses like what you're seeing relative to the housing and other topics on the docket. These are pretty modest expenses, but we're prepared to answer questions along those lines.
Okay. And thank you very much. I appreciate that. I just have one other question, and it goes to this slide here, the Camp Justice statistics. The very last one is exited into housing 42. I can't remember. I thought I heard it said that was not a good ratio. To me, that's an extremely good ratio. Am I incorrect? Because I'll just use the example. A lot of us here in this room remember Camp Hope, And I know that there were people placed, they were exited into housing from Camp Hope, but it was mainly through like Resiliency Village and some of these, through county programs. I don't recall anybody being placed into housing from any of the other campgrounds in the past. So that was big zero. And now we have 42 home placements from July 2nd of last year. What's your, I mean, this is a little bit asking your opinion, but what's your assessment of that placement ratio?
I think William is the one who mentioned that it wasn't as high as the navigation center, but I think to your point, Supervisor, yeah, this is a challenging population to work with. I think we're just like we strive for A's. We like those 90%, but I think to reflect on that, yeah, we're proud of that for sure.
Yeah, because I mean, I just remember how the battle days, I don't think the county was very successful at all at placing people into housing. And now here we have probably more people placed in 10 months than we did in 10 years prior to that. So
Yeah, I would almost defer to some of the lived experience people that we have in terms of what it means to be able to move into a safer and more secure area where you have ready access to services. I think I'm just guessing, but I can imagine that makes a big difference.
Thank you.
Supervisor Griefer, questions?
I kind of like to follow up on Supervisor Campbell's question. So could you hold that stat up again? The last line was 42. Oh, like I can read that. 42. When he says 42 exited the housing, what is defined housing?
Yeah, so that can look different. So basically, when we say exited to housing, we're talking about permanent housing. And for us, that's housing without an end date. So that's not to the navigation center because that's a 6-month program. So that's not permanent housing. Generally, we're talking to a private rental. Several of those are trailers that we're able to relocate to parks or to private property. Some of them are people who've moved in with family. There's additional fundings from some of the CBOs and other government entities to relocate people out of county if they can leave the county and then not be unsheltered. We can't dump our people on other places, but if we've had people who have family out of state that they could move in with, and there's funds out there that we can help them get and fly them back to, Arkansas or wherever they have a place that they can move in with family and be supported. So a lot of them is moving in with family, relocating out of state, finding a private rental. Some of those were not disclosed. They said, I found a place, I found housing, and I don't want to talk about it anymore. So that looks, different for everybody, but it's housing without an end date. It's not to a shelter. It's not to a county program.
No, and I think that's the reason I bring that up is I think that's a really super important thing to know, because I think a lot of people like myself, I heard, got into housing. Well, was that a county housing program or what have you? And when I was out there with you, right, we had that one gentleman walk up and say, hey, I want to go to Iowa or something. You're like, hey, give me a name and a number and I'll give you a plane ticket. So did that work out? You don't have to answer. I was just curious.
It's in the process.
All right. Well, so that's good, right? I mean, so I think that's part of this. I think that's very much a part of this process. Do we have the original footprint of what this property was originally declared? Do we have a map of that?
We do. I don't have
Actually,
it.
you can see it in this. I'm sorry.
Go for it.
No, I was just going to say the photos actually do a pretty good job of outlining that.
The other photo, please. Perfect. So
I can take a stab at that. So what you're seeing here obviously is an aerial photo. Initially, the top part of that where you can see kind of the gravel little outlets, those were the 9 designated trailer spots. And then kind of to the right of the rock pile, that was kind of open tent camping. So that was the original footprint, if you will. And then, obviously we've seen people kind of go into the overflow area and then that center area. There has been tents there in the past, but I think those have now all been reorganized. So that's the footprint.
Okay, and because when I was out there, when I toured it, as I expressed to some of the people that were out there, my concern is that if you look at the bottom right of this photo, you can see where trenches have been made, steps have been made, the area has been scrubbed and things like that. And as I explained to them, I can't support damaging the county's property if we're not going to be good stewards of said property. So I'm hesitant to expand the footprint if we're not staying within the footprint currently. So
I was just going to say, since you have been
Right.
out there and you
Of
addressed
course.
those concerns, that the sheriff's office had very similar concerns, and that sloped area at the bottom of the hill, there's no longer anyone there. And we are seeing the land kind of recover and heal
no,
itself
that's just,
somewhat.
again, and my general concern is that, you know, it is county property. We have a responsibility to protect the property. We also have a responsibility to make that area as safe as possible as well. And we're just doing questions-ish. Okay. Let's see. So the bounds. All right.
Ideally.
I know. I'm just trying to organize because I'm in favor of this, but as it is, meaning I don't want to see it expanded. I don't. I somewhat agree with Supervisor Kirk's position of we don't want this to be, I'm going to do the air quotes, comfortable position, because we want the person to say, I don't like living in this method. I want to get help. So I guess where I'm going with this is all of I've heard today is about people who want to get help, but it's never addressed about the people who don't want to get help. How do we address the ones who say, nope, I don't want to get help, and you can't, you know, after my 90 days now, we're going to kick them out and things like that. So it kind of seems like, how do we thread the needle on that?
This is a conversation that comes up often within the committee, and I hate to do this, but I'll have to defer to our sheriff. Is he still here? Yeah, there you, Sheriff. So it really just becomes, if you're not willing to be in the program, it becomes a situation where you can't be in the camp, and if you can't be in Camp Justice, and we are following the law, which means we're not going to be doing any illegal camping, we're not allowing illegal camping, this just becomes a law enforcement issue at that point. So I'll defer. Thank you, Sheriff.
What was the question?
I don't remember. How will law enforcement address the issues of the individuals who seek refuge at the camp for 90 days, choose not to take part in the services, you trespass them out, and now they're back, to use Tom's quote, which he said, they're in the wild?
That's a good question, and I think that that's all subject to whether this board decides to adjust those provisions. As they exist right now, violations of the rules are subject to trespass. There is existing authority. We've worked closely with council and our partners to trespass people from the camp. It would be my intent to maintain those provisions, and I think one of my biggest concerns is the more infrastructure and the more privacy that we add, there's a higher expectation of privacy, which does, in my opinion, also reduce the county's authority on how we're going to enforce those rules. Not that I think that that should be a deciding factor, but it is a factor to take into consideration when you talk about expanding and creating infrastructure. Also from a tactical perspective of being able to enter this camp from multiple locations and being able to have visibility would also be a concern from the outside looking in as we do conduct periodic patrol checks of that area. High visibility is a concern. But to answer your question, the trespass provisions and also any fish and game codes that are applicable, 150 feet from the high water mark from any waterway, whether there's actual water in it or not, is a concern as well, which is some of the provisions that allowed us to clear out the camps throughout the community prior to really being actively pursuing Camp Justice.
Okay. Thank you, Sheriff.
You're welcome.
My last couple questions are, so right now, all of the fees regarding Camp Justice are handled through IRF. Am I getting that right?
Well, if we're not using acronyms.
I know I'm breaking my own rules. I just needed to hear it once what it was.
Yes, all the funding has come through IRF. We do need to move some funding because we have spent that entire allocation of the grant in Camp Justice. So I do have a recommendation for this board to move some remaining funding that was covering the homeless service coordinator position, move that, or request from the state to move that to support ongoing operations at the camp. That's my recommendation.
Okay, because originally when it was set up, there was no trash, there was no porta potties, there was no water, correct? And are you, well, I mean, TUD wasn't.
TUD
what
was not.
Was it added in, the dumpsters were brought in, as my understanding, later as well, as a byproduct of not moving them out once a week?
So the site itself was actually used for camping before it became officially like a sanctioned camping. So there did have to be some moving, some clearing, some grading work that was done. Then we were bringing water in manually for a period of time. And then obviously the trash and porta potties have been there since it became operational.
Okay. And idea how much the water costs? I mean, I guess where I'm going with this is there's a big water difference between people who are camping there and then people who are bringing their RVs in and filling their tanks.
In looking at the expenses, it looks like about $2,000 a month we're paying between the porta potty and the water.
Okay. Okay, thank you.
Supervisor Holland?
Okay. On the slideshow says maximum stay of 90 days for those fail to refuse engage in services. Can we define services? Like what that looks like, what qualifies for services, a clearer picture?
I think that's something we're still working on, and I think it depends on the level of services we're able to offer. But I think it looks different for everybody. Some people might be engaged with behavioral health and working. I think it's just making conscious efforts to work towards a sustainable lifestyle and to find permanent housing. It's, if we identify them as someone who could benefit from behavioral health or from enhanced case management through one of our Cal-AIM partners or something, we would expect them to take our recommendations or give us alternative recommendations. Like, it's fluid. We want to help people at the end of the day. So I think that's going to be one of the difficult challenges, and that's going to be one of the probably main points people are kind of screaming at us about, is we're going to have to make those tough decisions on who is engaging with services and what's appropriate and what's not. So I think that's definitely a challenge, but I think we're prepared to work through that.
Okay. Currently, what is the longest stay allowed here? Is there an end date?
Not at this time. It's the original rules said that it was not intended for long-term stays, and they were encouraged to engage in services, and that's kind of some of the language we're looking to change. Is they're mandated to engage in services, that if they're not, then we would put that cap on it at 90 days. But if they're engaging in services, ideally no end date, but they wouldn't be there long because they're engaging in services is the thought process.
Okay, let me ask you a two-part question since you're the ones there all the time. You have somebody that gets sick, they're in the hospital, they lose their housing. But maybe they have some resources, they have a job, they just need to stay for a short term. What does their engagement in services look like in your mind, since you're a part of this conversation?
Yeah, I think if they have income, then it's looking for housing. If they don't have income, it depends on their barriers. Everybody ends up at the camp for a different reason. And
Yeah, just in that scenario.
Because
there would probably be a minimum contact, like, hey, I just need a short period of time, I'm going to go find an apartment, I'm out of here.
Yeah, I mean, that happens for sure. And then I think we would just be like, okay, then show us good faith effort that you're finding housing. We have housing search forms that we require some people to turn in, and that's a low level of case management. If someone already has income, they don't have behavioral health issues, they don't need SUD treatment, if they just got sick and lost it, or got divorced and lost it, or got, whatever that scenario is that winds them there, if they have the income, it's just looking for the housing, which is difficult because of the housing shortages, but I think it's just trying.
Okay. What about somebody that shows up that looks visibly mental health issues, on drugs, no job, no plan, no nothing? What does engaging in services look like in your mind to qualify to stay there in your mind?
That's going to look very different, right? And that's engaging with behavioral health services, and that's, maybe BH isn't a perfect fit for them, and then maybe we link them up with Red Feather Clinic. There's a lot of options in the community. They just need to be working with them, I think.
Okay. Sheriff?
No, I was just going to say, because there was drug use and possession type things brought up, know that the penal code and the health and safety codes are enforced at Camp Justice, regardless of what the status is for services. If you're in possession of drugs, if we receive calls from people inside the camps that you're in possession of drugs, we investigate those, and the penalties exist the same way they would anyone else in the community.
And if the sheriff's office catches you with illegal drugs at the camp, you are trespassed. There's a zero tolerance for that.
Okay.
Just a quick follow-up on that. One of the reasons why we wanted to look at the intake center versus the program is that, and this needs to be discussed and we need your input on it, but we're looking at the intake section of the camp as being somewhat lower barrier. So, and then if you're in program, then the expectation would be that you're sober or working towards sober all the time and engaging in, with the appropriate services to help you with that. I know that's kind of implied by what we're doing here, but we weren't specific about laying that out.
And I might add that, a lot of this, again, visionary discussion, it would depend on the funding. There may be some funding restrictions that we would have to look at for program site. Just don't want to lose sight of that.
So if we're using the ERF, whatever we're calling it, funding, and we're talking about almost all of it's going to have to be sucked up and used for possibly Highway 108, Snell Street, but it's also being used for Camp Justice, and you're saying we could maybe take some of that was set aside for the housing coordinator's position. How long does that realistically last under this model right now?
The current model?
Yes, the current model.
It would
until this
last,
runs
I
out.
think, about a year, close to a year. I think the thought would be that if the board would like us to pursue additional funding, we would be looking at that IRF. That's another round of IRF coming on board and targeting that.
Okay. And then you guys brought up a fence, and someone said that you guys have an idea of a cost. How many square feet, how many linear feet is this fence? What are you guys talking about in cost? And what's your guys' vision on that?
Let's see, where's my fence line here? The line for the fencing. Okay, well, it depends a little bit. If we move the RVs out, then we don't have to expand the size, the dimensions of the site very much. We can just separate it into the intake and the program sites. So you can kind of estimate what that fencing amount would be right there. I mean, that's what, 120 by 200.
600 feet?
Times 600 feet of maybe we'll go with 5 foot, privacy fencing, maybe a chain link that has the slats in it, something along those lines. And if we were to do something like that, it might be in the range of, let's see what do I have in here. It might be in the range of 25,000 or so to do that.
Don't forget, we're a government entity. It'll cost you $80,000. Because it's right here in the Four Creeks bid. 645 feet is $83,000.
Yeah, let's see if we can't maybe get that.
We cannot. We're a government.
We have to pay the prices. If it's going to be on county property, we have to. Okay, well, that's going to have to be a conversation later on.
So we'll assume fence is out then, because we don't have $83,000 last time I checked, Andy.
Maybe we could build a deck.
Yes, well played. We will need $500,000 for that.
I had to, I'm sorry.
Yeah, the deck. I love the deck. Okay. So, and one more question on this, as I'm looking at this picture, at what point, what is the difference between camping and an RV park at this point in time? Because I look at that row, and when is Quincy going to show up and want rent control fees for that space?
Yeah, I think I think there's general support in exploring an alternate plan for the RVs. That has far exceeded what we anticipated. Right now too, we do have folks out there in RVs that have income, and if you were to say, well, there's a space rent over here for X amount of dollars, or you could stay at Camp Justice for free, what are people going to choose? So I do think we have to ask those hard questions, and we have to look at whether or not that still is something we can provide there.
Okay, and my last question is, I don't know what slide it was on, but it talked about, different standards for acceptance, and it said local something or another. Who's making that decision, and what does that look like? I wasn't quite sure what that meant, and who's actually the person that's making the decision on if you qualify to be here? Someone you just show up, or you just is there actually William says, hi, here's your ticket number?
No, when I was mentioning that, I was really kind of speaking to how we would prioritize services. And I don't know how that gets managed today. If someone just walks in off the street and they're from Fresno, And you probably have a conversation with them, where are you coming from? What's your situation, right? You figure that out. I don't know exactly how we would sort that out differently than we might today. But that's the intent, would be to try to serve those that drop into an unhoused situation or difficult situation where Camp Justice is really the only option that they have at the moment, and that we would try to serve local residents first, where this just became the residents, but a day ago it was, over somewhere else in the county, and that was the intent of that. How we would manage that, I don't know yet.
Okay, because it's on your guys, I found it. It's on the guiding principles, and it says who meet local requirements. So I was trying to figure out what the local requirements are, who's making that decision, and do we have like a no vacancy sign? Like, is there a capacity, or you just show up? Like, I'm not trying to make light hard, but like we're like, hey, only so many people fit, and who makes that decision?
I can tell you right now, there's a lot of people showing up at night,
I would imagine.
People get released from jail at odd hours and they walk over and set up camp, So a lot of that is us showing up out there every day, seeing who's out there, knowing who's out there. We contact people. We say, hey, these are the rules to be here. You have to agree by. They sign a rules agreement. And then we start that conversation. Where are you from? Why are you here? You should probably go back. It's not a great conversation to have, but we're very candid that we don't have resources in this county for people from out of the area. Our general rule is very, very limited or no help for at least 90 days. If you're in the first 90 days in the county, we don't have much for you other than a spot in the dirt at Camp Justice. And if you stick it out past that, most don't. I will tell you that. Most go back where they came from.
And if it helps, we've had this discussion a bit too, I think is also dependent on funding, correct? Of whether we have the authority to make a local requirement, or, if it's general fund money, I believe we can. If it's not, then we have whatever the restrictions are, if that helps.
So is there a maximum limit for Camp Justice currently?
There is no maximum limit. Like for RVs, we're capped at RVs, and we generally have a wait list of RVs to get in. 17 is RVs.
So that's what I was starting to count. So they're actually like calling and making a reservation, in a way.
I wouldn't say that. I would say they're calling and saying, hey, we just got a red tag on our trailer that it's going to get towed in 3 days. We have nowhere else to go.
And how often are out of the 17, is there a changeover? Like how often are is there any swap out, or these 17 have been here and they don't plan on going anywhere?
I wouldn't say all 17. There's been some movement. We just had someone move out last week, and that was a situation, long-term Tuolumne County resident, HHSA staff made contact. Hey, you're here at the camp. Do you have income? No. How old are you? 65. Why don't you have Social Security? Did you work? Yeah, I worked my whole life. Drove him down to Social Security, signed up, got approved for Social Security. A week later, got his check, said, thank you, I'm headed to Oregon, and drove off. So we were able to call the first person on the wait list and say, hey, we have a trailer spot available. So that's kind of how it's working right now.
Another little logistical thing, when we're trying to move people out to do cleaning, to clean with trailers and RVs in place. We have people in the community that come with big trucks and try to drag them out, and they put them in the temporary parking space over by the jail side entrance. It just becomes a logistical nightmare to have the tents and the RVs together in that regard.
And Supervisor, so just checking in, I want to say first, I'm very proud of all of us, our staff, the board, the public, everybody hanging in with us and the discussion. I do see Supervisor Kirk. So I want to say great job. Second thing, this was all meant to end at 12, so I want to do a time check just on that for everybody. I know that I have an appointment coming up at 3. We're approximately twice as long as this meeting, and it's a good discussion. So just with the conversations, since we're not through all of the projects yet, we still have to give direction. just to keep that in mind. We also have public comment. I imagine most folks in the audience may want to speak as well. So just FYI, I mentioned, so Supervisor Kirk, and I believe you have a follow-up, Supervisor Griefer after.
Yeah, I looked at the next project where we're housing veterans. We can skip that. I'm gonna support housing veterans, but one of the things I said at the beginning, and this is a question, but I think we need to get into like, what are we gonna do, because we're running out of time. At the beginning of all this conversation years ago, I've given Annie a little bit of a heads up since she came into it. I wanted to know, what is our success rate? What housing do we have? How many bed spaces do we have? And what is our success rate within those bed spaces? And the reason why I maybe should have been more clear up front. The reason why I want to know that is because it says that we've put 145 people in permanent housing since January 2023. So, Annie, my question, and this will take me back to Camp Justice and all the other projects, because what I want to know is, how many bed spaces do we have currently available right now? And then if you divide that by 145 since 2023, do we have extra bed space right now? Do we have people on waiting lists because we don't have enough bed space? Because that's going to help determine whether I want to cut one of these projects or expand any of these projects. But I'd like to know that so I can make a decision on these sites moving forward today.
Sure, I can field that one. I do have a slide queued up. I don't know if we can show it. To answer that question, Supervisor, we did try to reach out to, again, recognizing that the county is just a small part of this larger picture of providing housing. And so very thankful for our community partners that were willing to share this data with us. What you see here is all the different types of housing programs that are running or very close to running outside of the county circle. So you can see that if we calculate all those up, about 212 beds. You'll note on the right there that there's not necessarily a lot that are very generally open to anybody. So there's a lot of, for CNBC, for example, you could only go into that program if you have certain eligibility criteria. So this is a representation of the community, and then we did the same thing for Health and Human Services. You'll notice a lot of those are obviously behavioral health, and we always walk that line to make sure we differentiate that not all behavioral health housing is homeless housing. So Tammy might want to speak more to that. But what you'll see here is that if we look at the current operational programs that we have 79 beds approximately, and then if we were to move forward with Snell, 108, and Columbia Way, that would add an additional 56.
We're at, in theory, 79 right now, and we would be adding 56?
79 current, and we'd be adding 56 more.
And the 56 includes Snell, it includes the veterans, and it includes the minors in 108?
Correct.
Okay. So my next question is, do we need all 56 of those bed spaces? If, based on our success rate from, say, 2023, what's being presented on the dashboard, let me go back to the dashboard. It says that we've had permanent housing 145, temporary housing provided 421. I'm trying to figure out where those numbers would land on our bed space. Does that make sense?
Yeah, I think, it's a hard question to answer. I think if I were to talk to the other providers in the room, many of them are full. Many of them have wait lists. We did do some digging around on this issue to try to, I think what we're seeing kind of on the horizon that we're really concerned about is the elderly and disabled population and how that is slated to really skyrocket in terms of our aging population. So I did get some data from like Area 12 on aging about how many calls they receive in a given period of time asking for housing, and I think it was like, I can pull it. We also, implemented our new 211. The majority of the calls we're getting there is also housing related. And then I had one staff kind of call around to some of the senior apartments. And just for one example, the wait list on one is 4 to 5 years to get in. And so trying to take all of that and then answer your question, Supervisor Kirk, I think there is still a need. And I think I would look to other experts in the room.
Maybe an easier way to put this is those 79 current beds are all fully occupied. Is that correct?
No, I'm not. No, the navigation center is not fully at 45. The trailers are fully occupied, I believe, and all the behavioral health is maxed out. So yes, minus the navigation center, everything else is full.
Okay, that's kind of getting to the heart of what I'm trying to understand is what do we need versus what do we currently have? And I think if somebody can clearly articulate to me what we need, then it will help me understand what I want to support moving forward. Since we're trying to get through Camp Justice, are we still doing questions, Jaren, or do we want to just jump into recommendations and comments, or how do you want to handle this moving forward?
Yeah.
That's it for my question.
Okay, so we were doing questions. I know you got a follow-up there. I'm not really going to have any questions with it. So again, time check, 2:40. Okay. This is just my recommendation is taking this. I think we need additional time with this. Obviously, this has been a very good discussion, but the direction discussion will take some time. We've had a lot of, not just what you've brought forward, which are a little simpler, do it, don't do it, do this, do that. There's many things that Tom and the team have brought forward too about fire pits or the service site, and I think that conversation could take an equally long amount of time on some of these things as just questioning the project. So my recommendation would be we open up public comment. We were able to receive that. After that, we make a determination if we would like to continue and then give direction today. I would recommend we schedule another meeting like this, perhaps sometime next week, where the focus is not all the background here, but we pull all together and be able to give direction. That's my thought. Otherwise, we could be here till 6 or 7, and I know I got to leave at 3. So with that, is that fine? You mentioned you're okay with holding off on the question for now? Okay.
Supervisor Britton, I would like us to address the Snell piece. I think if we can at least do that today, I think we could bring everything else back.
Okay. Would it be all right? I'm thinking we open up.
Can I recommend one thing?
Yes.
We've spent a lot of time invested, interest in this in the community. I don't know if you want to give your thoughts and recommendations, and then we could carry on, Jaren, or if we really want to do this all kind of over again next week. But like, if you want to take 20 minutes to give all your thoughts and recommendations, we could also do that and just finish this thing out. I feel like we're kind of towards the end.
Sure. The main issue is we've had a lot of folks in the room waiting to give, I think, public comment, and that will probably take 20 to maybe 30 minutes. It could. And not wanting to give direction on this stuff, I think, before we basically take in public comment. So we're kind of in a weird spot with that, right? So let's open public comment and see how that goes right now. If there's no opposition to that, we will open public comment on this item. Again, as we're kind of doing it, I know we did some open public comment earlier today, so we're going to allow people to be able to come back up. They'll have 3 minutes on this item, so if folks don't mind lining up and being able to be here. And again, thank you for your patience and hanging with us this whole conversation. And can I get a show of hands real quick of how many folks are planning to make a public comment? 1, 2, 3, 6, 7. Okay, great. Thank you. Morning.
Thank you for
afternoon.
Thank you for letting me speak. My name is James Nash.
And a little closer to the mic, sir.
A two-tour survivor of Camp Justice. I got there.
Closer to the mic. Yes, sir. Thank you.
I'm a two-time survivor of Camp Justice. I just exited last night, so you got one more trailer spot available. Here's the thing. You can't shut Camp Justice down, okay? First and foremost, that can't happen. If you do that, it's going to be a nightmare for this man right here, okay? That jail is right across the street. It's too easy. It's a revolving door. This is, what are we doing? It's generating revenue, because that's all we're doing here. We're going to parameter this until What was that piece of paper? Yeah, 12 things I want to talk about. But here's the most important thing. If you want to help these people, you have to give them the inspiration and motivation for them to help themselves first, okay? They have to want to get out of there. If they don't, that does not exist. It doesn't care. What you give them a house, it doesn't matter, okay? It doesn't matter. They have to want to get out of there. First and foremost, you need a co-op. You need a workers' co-op, okay? Where everybody has a job. You build facilities, and you have a shelter, and people who work, they work for their stay, and they make a little bit of money. And everybody does something. They do laundry. They cook. They have a garden, a community garden. Everybody has a garden. Your extra produce goes to sell it. I mean, you got to do something here. And $2 million for 19 rooms is pathetic. That is the most insane thing I've ever heard. What in the hell are we doing with $2 million in 19 rooms? I mean, come on now. How many trailers we got out there? How many people we got out there? I mean, you could build a motel right there that would look just fine from the highway. You could build a motel with, I don't know, maybe 60, 70 rooms in there. Or you could buy those campers that you were talking about, the trailers, for construction, for, construction offices. Why don't you buy every one of those, buy a bunch of those, stick them there, so that everybody that's in a tent can get one of those, make them work for it. You got to do something. There's got to be some way, because if you don't inspire these people to get up and go out, it doesn't matter you bring them food or anything else.
And you have 1 minute when the beep happens too, just as an FYI. Yeah, that's just a 1 minute notice.
But, so my suggestion is, what?
There's a timer up there. Yeah.
Okay. Take the $2 million that you're going to spend on this building that's not going to be ready until 2027 and invest it in a co-op. Get those big, nice tents, right? And get these people to work together. If you can't get these people to work for their stay and work for, follow the rules. Don't get caught with dope. You know what I'm saying? And you got functioning addicts and you got dysfunctional addicts. You got institutionalized people that are getting out and walking across the street every day. Okay? Duh. We all know there's plenty of drugs in Camp Justice. What are the qualifications for Camp Justice? Is it methadone and Suboxone? Because that's what you can get for qualifications, and everyone that does Fetty will qualify off the gate. So, but you have, I just got out last night, and thank you, Jesus, for that.
Great. Thank you, sir. Good afternoon.
Hi, good afternoon. Lisa Silva with Master Care. I just wanted to say that we have been in talks about future partnership and collaboration, and we have all been collaborating, boots on the ground. We're a CalAIM provider, so there is a lot of opportunity for usage of the programs of local collaborators that have that services, enhanced care management. So we can support with case management. We do have the ability to transition the elderly disabled through nursing facility transition diversion, which would be assisted living, out of the county right now because there's no local assisted living facilities, Skyline, Meadowview, that utilize the CalAIM program, but outside of Tuolumne County they do. So we're successfully transitioning outside of the county. When it comes to Camp Justice and the folks that are have been working so hard to facilitate this as a pilot program, we're so close to being, it's just really gaining momentum. They've been working really hard. 42 successes is amazing. As a boots on the ground caseworker, if I have one success, that's what we all really strive for. Just wanted to kind of mention, the comfortable aspect of Camp Justice. Ain't nobody comfortable. So that we're not making anybody comfortable. We're supporting. We're giving someone a chance by offering services. And having a timeline makes sense because I think there has to be rules and guidelines with that. There has to be some set of if you break a rule, there has to be consequences. There has to be consequences. If someone didn't give me a chance, back in my day, I'm a lived experience. It's been a long time, but I never forget where I came from. And so if it wasn't for that, for the people that supported me, I wouldn't have the beautiful life that I have today. And I think that's why a lot of us here do what we do. I know that I'm surrounded in a room with people that are I'm honored and privileged to be a part of. So use us, right? Because we want to be part of the conversation. This is gone too far and to stop now. We would just create much more havoc. The support that we would be dealing with as boots on the ground workers would be astronomical. So thank you for opening this up, and I appreciate your time today and look forward to more conversations.
Great, thank you. Good afternoon.
Hi, my name is Irana Ross. I'm a resident here in Tuolumne, and I wrote a few words. As a citizen who wants our unsheltered neighbors in Tuolumne County to have all of their needs met, I thank everyone who presented here today, and don't doubt that all of you and everyone in this room wants the same. Thank you as well, Mr. Griefer, for your intelligent and pointed questions about the complexities of the Highway 108 site. However, after sitting here for 3 hours this morning, listening to a multitude of questions focused on minutia with little to no progress, I was disappointed in and shocked by the lack of knowledge, empathy, and preparation by so many, as well as the lack of presence of any currently unsheltered citizens in this conversation. Given that, I want to know that Camp Justice and the services and staff connected to it is fully supported in continuing to provide the critical service that it offers, that knowledgeable, compassionate, transparent, and inclusive leadership is guiding every level of policy, financing, and engagement in these processes, rather than wasting time and money going down rabbit holes of minutia and equating our unsheltered neighbors with prison inmates. That real action is being taken, that funds are being allocated wisely, and that the numbers and talking points that add up to real boots on the ground solutions for our unsheltered neighbors with respect and the care they deserve, regardless of where they live or what they do. And as much as we citizens who have the privilege of having most of our needs or all of them met say we want to be helpful, it seems to me there's a massive gap between our words and our actions. We must spend time listening to our unsheltered neighbors to find out what they need rather than what we think they need. They must be included as integral contributors to this conversation that affects them the most. Because in the end, we are talking about people's lives, not numbers on a spreadsheet. Thank you.
Great, thank you. Good afternoon.
Hi, my name is Nikki Hiskey. I work for ATCA. I'm also part of the Homelessness Committee and a member of the host team. So when you say the words boots on the ground, that's what we as providers sitting in this room really are. I think the difference right now in the way that we are providing services is the collaborative effort that we all take with one another. In the past, it's been this provider's done this or that provider's done that, and we're not doing that. We are mixing and we're matching and we're not gatekeeping and all of the things. We're saying, hey, let's show the transparency. Let's show what bed spaces we have. Let's show what work we're doing. Let's show this, let's show that, and it's working. I can say that we have 18 exited clients from, like I said, I run the shelter. I have 18 exited clients successfully exited. And that could be in a long-term recovery program, that could be in permanent housing, a multitude of places. It could be relocating them, like we said, out of state, and we do have a grant that does that for us. But 18 exited clients that have came from the camp into the shelter and have been successfully placed somewhere else. I also have 9 people right now that we have brought as a team from the camp to the shelter. I provide intensive case management at the shelter in something that's a little different than the camp, which that piece needs to change maybe probably, and then move them on to Navigation Center also. We have a whole system that is being provided right now. I think the idea today with Camp Justice is being able to extend Camp Justice through that December period without affecting the general fund at all. And that would be the encampment resolution piece. And then the vision of the 2.0 is past, it's in the future. But today, being able to keep that camp open. When Supervisor Kirk asked about the bed situation, we have over 50 to 60 people in tents right now, and then the RV people as well out at the camp. That's the people that are going to be put into those beds. It's not comfortable for them. One of the things about engaging into services, it does take longer than 30 days. It takes longer than 30 days at the shelter for me sometimes, and I've got everything at my fingertips. Getting them on Medi-Cal can sometimes be a process. If they have came from another county, there's a process to be able to get that transfer into place, and that could take anywhere from up to 30 to 45 days, and then it takes time to switch over into our county for a certain amount of time as well. So 30 days is really pushing the fact of being somebody to be able to engage and accept those services. Sometimes it's about building trust and rapport, and we have to do those things. This isn't always the hand that they've chosen. This is the hand sometimes they've been dealt with. And it is our jobs to provide these services.
Thank you. Good afternoon.
Hi, I'm Jen Salazar. I've come in front of the board several times, so I think you pretty much have a good idea of how I feel. The camp is working. I know I had a lot of complaints in the beginning, but right now it's become a place where people it's really the only place safe for people to go. So instead of using my time, I'm going to read a letter from somebody from the camp. It says, "Hi, I'm just writing as I can attend in person. My note is as good as my word. Heard you about your meeting last night, so I'll try to keep it short. I think you have a good thing going here, maybe some upgrades. Like everyone in a tent lives in a shed on wheels so it can be moved around to meet your requirements of moving out every month. Maybe could just be done so you don't have to move them. I could build them for you, as I'm quite crafty. I've remodeled and built all my life. It wouldn't be an eyesore, cute little shed cottages for everyone. Maybe give me a helper and we could build one a day, all painted and roofed. Also, this is the only homeless place around, no place for us to go. I know, I'm not complaining, except for every place I rest my head, policemen usually come up to me and say I can't stay there. So I have to move on. Run out of places to go. This is my last resort. Also, my brother told me that they got billions of dollars, maybe millions, not sure, forgot. Maybe they forgot about me, but I'm homeless for 12 years in this state. You would think that I'm a citizen of California by now. I should be at least get a position, right? Let's say everybody gets $1 million. I should get at least 500,000, right? I mean, they're my golden years, maybe motel rooms for everyone. I mean, $500,000 probably wouldn't be homeless anymore. I'm a person needing things like stability, a place to rest my head, broken back, neck, 7 ribs, popped out spine, curvature of spine, bad brain, heart, shoulders, hips, knees, my hair, that's for crying out loud. Sorry, but this is something I appreciate very much. Thank you, Jeff Bayless." And, like I said, other than that, I've pretty much expressed my feelings about the camp. As far as the other projects go, I think you just need to focus on what's working, and the camp is working. Maybe make improvements. Stop assuming everybody is criminals and treating them like criminals, because they're not. That's a fact. So basically, focus on the camp, I think, is the most important. And that's it. Thank you.
Great, thank you. Good afternoon.
Good afternoon. Chris Nez, Homeless Outreach Coordinator for the City of Sonora. I'm also with the host team, admin for the host team. And so my involvement with the unsheltered started with myself in 2014. Never been in any situation like that in my life. Found out about didn't even know there was a shelter, didn't know what a homeless shelter really even was. I seen it on TV, that was it. Didn't know there was one in the county, found out there was one in the county, stayed there. Eventually, after about about 6 months after I left, I was working there part-time. 6 months after that, I ran it for roughly 7.5 years. I was the only show in town besides CNVC. CNVC was always full. Now we have options. It's taken years and years and years to have options. and I sure hate to see it get all flushed down the drain. The camp especially, everyone's centrally located there pretty much. In the city, I'm noticing that there's some new camps popping up. We will deal with that. We always try to refer them to other services. Same with the host team. There's 5 of us here from the host team right now. That's how big this host team is and how much these people care. With the host team, we've had a lot of success. It's a lot easier to find people in a central location than it is going out searching for them. And now camping and I hate to say that term, camping in the wilderness is not allowed anymore. So where are these people going to go? I asked you guys that question. There's 50 plus people there. Where are they going to go? They're going to go into your neighborhoods. They're going to go back to where they came from. They'll go in and out of Burgle. They'll go in and out of Rawhide. I guarantee it. I've been around this too much to know. Do yourselves a favor. The camp has got to stay open, and also the other projects I would love to see go forward too. Yeah, that's basically all I got. Thanks.
Great, thank you. Good afternoon.
Good afternoon, Jacob Helm, Sir Knight Jacob Helm, Knight of the Order of the Red Cross. The Red Cross is a subject that I'm familiar with, so it's a similar correlating matter. Thank you all so much for even dedicating the time to these resources. With this being the United States being party to the United Nations Convention Against Torture and Cruel and Inhumane Degrading Treatments or Punishments or Acts, we're required to maintain treaty compliance with international humanitarian relief centers and to assure the United Nations and all those who are party to the treaty and delegating authority and higher authority than I have yet worked for. But I work a lot with them, and so I appreciate the fact that this is the first county in California that I've experienced an international humanitarian relief center or zone that I would consider that would be even remotely in compliance with what's required to maintain what the International Criminal Court and Court of Justice requires to be sustaining life, and to provide the resources that are required. That I have, considered that. So I appreciate that we are within compliance, and that should improve our overall trade obligations and tariffs. So we're required to do this internationally. So it's pretty cool. I like that I like the state's proposed budgets. It's not too bad. It's more expensive than I would have considered originally, just because But historical property is different. I work mostly historical. So thank you all, and we hope. So we're looking for at least another annual improvement, right? And refinancing. If you need to, I'll look into resources too. But the United Nations has all you'd have to do is like a letter of assistance to the head of military operational command there, and they'll refer you to the Security Council. We have an endowment fund we all pay for internationally. So thank you all. Thank you for your time. And so I'll see what I can do as a college student to improve our resources and opportunities as well.
Great. Thank you for your comments.
Thank you all, and God bless us on our court.
Thank you. Hi. Good afternoon.
My name is Joe Sam. I'm Mike's neighbor, so he puts up with me a lot.
I'm sorry.
May 8th came and went. May 8th came and went kind of unnoticed by me because 18 years ago in 2007, I was diagnosed with stage 3 colon cancer. And our whole world, our successful business, 7-year-old twins, was yanked out from underneath me. Almost lost my house. Almost was a Camp Justice type resident. There's an outfit called Interfaith that helped us. We now help there. And we visit Camp Justice on a regular basis. And personally, my wife and I, Kristen, have helped 3 people get out of that camp into permanent housing. And that's not in your 42. There's a community out here that wants to help. And one of the nice things about one of the hidden benefits of Camp Justice and its structure is I'd no more walk off into a creek bed to help somebody than fly to the moon. But I can go to Camp Justice because I know it's safe there, not only for the folks that live there, but for us to visit and offer help. You have a community around you that is huge and likes to help people. They help. Our whole neighborhood came out to help when I was going through chemo. And I am still here because our neighborhood came together and helped me. So you have a community around you that is part of this. You guys, these are the front runners. You guys make all the money decisions, but there's a huge community that wants to help. They don't want to see some people suffer. So somehow, some way, tap into that. We're doing our part, what we feel we want to do. You have Interfaith. You have all these different programs out here that are helping these people. I had a young lady, she's 70, first-time homeless, come to my services, just asking for shampoo because she lost everything because she couldn't pay her rent and they threw her out. 70 years old, and she's living in a car. That's not right. So the community can help and make a difference. So thank you.
Thank you. Good afternoon.
Good afternoon. Before I start my official statement, I'd like to personally thank all you folks for all your hard work. Thank you. I'm Leonidas Russell, Action Chair of the League of Women Voters of the Mother Lode. The League of Women Voters of the Mother Lode, together with the League of Women Voters of California, support county and statewide actions to reduce and eliminate homelessness. Camp Justice, the Navigation Center, and transitional housing are example of county programs that are working to achieve these goals. Lack of support for these goals would worsen the homeless situation in our community and jeopardize future funding. We urge you to continue your support for these successful programs. And I'd like to leave you with a question. What are the alternatives available to our fellow citizens if you do not continue these successful programs? Thank you.
Great, thank you.
Last
Sheriff.
one, I think. Dave Vasquez, Sheriff of Tuolumne County. I just wanted to take an opportunity to share some thoughts conceptually about the discussion that we've had here today. I'm eternally grateful for all of the partners associated with putting the presentation together. It has been a very interesting last year. And so all of this coming together means something a little different to everyone, but I would be remiss if I didn't share my thoughts as a sheriff of what this camp has been in utility for my ability to protect this county. Shortly after I took office, I made a promise to all of you that homeless encampments throughout the community amongst our schools and neighborhoods were unacceptable. That was true then, it's true now. This Camp Justice has been instrumental in helping me achieve a peaceful resolution. We've heard several people talk about what could happen if we didn't have Camp Justice, then people would go back to where they came from, other camps. I'm here to say that's not an option. Going back to those other camps is not an option. But I will say this. Camp Justice has been the bridge of that gap. And at the end of the day, there's a certain quality of life, there's a certain expectation of constitutional protections that all people rate in this county, and I think that applies to everyone in our community. I would say this. When I send my deputy sheriffs into situations that are highly complicated, that are consistent with mental health, drug addiction, all kinds of other things, crisis, it's helpful knowing that when we show up and when we arrive, we have a peaceful resolution that we can start to work towards from the moment we arrive. Because the moment we arrive, that is the first level of force. It's officer presence, the deputies showing up. And I said this before in a previous board meeting, if we have no option, and at the time we were waiting on a Supreme Court decision, so we didn't know if we were on the hook for what we'd have to provide or not, but we do have consequential information now that shows that it is effective. Now, as a legislative board, you have a difficult decision to make because we are in fiscal challenging times. But I will say this, if it means anything to your thought process and the totality of the circumstances of what we do and what we choose to fund, I can attest to not to any of the other projects, and I'm speaking conceptually, not about the 2.0 or all the expansions, but I know that what we have right now has been effective. It needs work. And there's times where we've had to go in and button up things and tighten things up. It is serving a purpose. And if for nothing else, if we're not utilizing cleaning up the community of these illegal camps as a measure of success, please take that into consideration because I think it's a huge measure of success for all of our people in the community. A conduit into resources. We know, we have the knowledge that knows that that is effective beyond any other programs that we've seen. And it gives the deputy sheriffs the highest likelihood to be successful without having to use force. And that's important to everybody that goes into these situations because oftentimes they're unforgiving. So I will just say that that's what it means to me as a sheriff, having this service, having this utility. Again, conceptually, I'm not saying that I'm supporting or putting my support behind expanding beyond whatever it is right now. I think what we have, we can work towards perfecting that a little bit more. And I think that with data and time and other resources, maybe that does grow into something else. That's your decision. But I just wanted to share those thoughts of how I've been able to implement that, how it assists me in protecting the people of Tuolumne County. Thank you.
Great. Sheriff, thank you. All right. I know, but we don't want to allow booze. I know, I got to be a stickler on that. But well said. All right, not seeing anybody else, I'm going to close public comment. I'm going to be having, because I have a prior appointment and we're about 3 hours over, so I tried to give enough time and I did not. Be handing this off to Supervisor Campbell at Supervisor Kirk's, I think, recommendation. I was only going to say onto this, as far as any of these, for any direction, if it does end up getting there, and I think can decide how to handle the rest of the meeting, that with the Snell Street property, that would be appropriate to consider for some type of I think a domestic violence or women's shelter in particular. I think that is one of the most vulnerable populations when we have in the homeless community. Tends to be single women and elderly women. And they also tend to be a lower risk population to be in a residential home without management. I think with the veterans property, we absolutely should do it, but should look to see whether we can offer space to other surrounding counties where they're having difficulty. Obviously, there's some criteria of how many people fit that. We want to make sure that it is also used to its maximum capacity, and that may also help support it. And I support all of the recommendations from staff and from the Homelessness Committee, particularly with Camp Justice. The only concern that I have is doing anything that allows for tenancy. I think it needs to be temporary. I do agree that it needs to have the clearing out at points, that is a tactic. Behave well, and we do it less often. If it's not taken care of, we do it more often. But overall, I only want to say that I'm really proud of you and everybody. I'm proud of the enforcement. I'm proud of all of our nonprofits in the city. This is not a pretty thing, and it is not a hugely popular to start thing. I think what we have is something that is exceptional in this county that I have yet to see replicated in another county for the recovery outcomes, the price per day outcomes there, and the partnership. So that's all I wanted to say is I trust the board to make decisions on the rest. I do support all the recommendations on the projects and continuing forward with all of them. So, wonderful.
All right. Thank you, Supervisor Brandon. Okay, so we have heard from our community members, and I'm very grateful for that. Oh, yeah, I guess I better start hammering things. Haven't hammered the gavel in a while, so. Appreciate all the comments, and I think it's very valuable input, and I absolutely appreciate the comments and the input that we received from staff and from the team that made this happen. What I wanted to gauge, so we do have to come to some kind of resolution on the Snell Street property today, because we have an item that's held over from yesterday from the regular Board of Supervisors meeting that was left unresolved. What is the feeling amongst the board about continuing this discussion processing some of the information that we've received today on the other items, except for Snell Street, to another day.
I'd be okay with making a motion to accept, to discuss and vote on on the Snell Street contract now.
Okay. So,
Yeah, that's what I'm saying. I mean, I'd be
Yeah.
okay with knocking that one out and.
okay. So shall we continue this special meeting on to a date? Would we have to determine what date in the future that would be right now, Sarah?
If you're going to adjourn the meeting again, then we need to do it to a time and place certain, but if you're just going to continue it to a future meeting without anything specific, then we don't have to set
Let me
that date.
rephrase. What would be your recommendation about how to best continue this so that we could have a discussion in the future and allow the public time to be noticed of that?
Probably just be easiest to not adjourn it, to just continue it to another board meeting
Okay.
day. So we'll
So-
actually end up closing out both meetings.
So perhaps we could continue it to a regular board meeting, understanding that discussions about homelessness do typically, Supervisor Kirk can back me up on this. Anytime homelessness comes up as a discussion item, it's never a short conversation, but perhaps there's a regular board meeting that we could clear out a substantial amount of time to resolve some of these other.
Well,
Supervisor Kirk?
yeah, I was just gonna say, we've done so much today, but I get that we need to wrap it up, and I think we could put this on a regular scheduled agenda. And we've had all the information, we just need to chew on it and get some information maybe between now and then, and give some direction, have some votes at a later date. But to the Snell Street, I think we should definitely decide on that right now.
And I'm setting Snell Street aside. I'm saying the other things. And I will say honestly, I am least familiar with the plan for the veterans apartments on Columbia Way, and I was interested in getting information about that, but it looks like we don't have enough time for that. So that is one area that I will say flat out I'm not prepared to make a decision on because I don't have the information on it yet. Some of these other things I'm a bit more familiar with, but that one in particular I'm not. So does that work? Do you, that we continue this for a future regular board meeting on a Tuesday? Okay.
Yeah, it works for me.
Okay.
And one other thing, just because we do have some public members participating via Zoom, we want to make sure if they have public comment, they have the opportunity to comment as well.
Okay, so we have not done that? Okay, so what I'd like to do is allow the people participating by Zoom to have public comment. Then we will close this special meeting to be reopened at a future date during a regular board meeting. And then we will go into the continued discussion from yesterday related to Snell Street.
Do we have to make it, can't we just make an agenda item of this?
Does that work?
Yeah,
Yeah.
we just be done with the meetings today and make an agenda item.
And I might just remind everybody that we would need to do that, at least the camp, relatively soon, because we're coming up on either needing to move some additional funding to support it past the 1-year mark. So I'm not sure when you guys are thinking to continue it to, but that is something that we need to work on if the recommendation is to continue with the camp.
What's your date that you need to buy?
The camp,
Today.
the pilot is slated to end 1st of July.
Oh, okay.
We could just say, we could make the decision to just leave everything status quo at Camp Justice right now, but decide to fund it until, so is that, right, we could do that today,
Well,
could we not?
The recommendation we have is to extend the pilot program to the end of 2025. So
So I would,
could we perhaps agree to that? And
if
then,
that is the recommendation, then that would give me direction to seek the funding to get us to that point.
okay, so we're not providing feedback on some of these other
No,
recommendations by the
right, then we
committee?
would come back to, I think we would revisit that with the feedback to how we want to move forward, but at least this way it gives her the green light to move forward on
Yeah.
getting the funding, and we can extend it out to the end of the year.
Yeah, so we're buying you
6 months.
Yeah, 4, 6, 5 months.
Something.
Okay, is that acceptable? So
Yeah,
it would
I
be
think,
status quo essentially.
Vice Chair?
Oh, go ahead, Anaya, you can go first.
Go ahead, Anaya.
I'm fine with saying okay for the funding, but I don't want to push this off 6 months. We just invested our entire day and staff hours. I'd like to see this come back real quick so we can give direction.
Well, I think what, not to put words in Annie's mouth, but she's concerned about not going forward without having direction from us that she should be looking for additional funding for Camp Justice. Because if we were to say today, we don't like Camp Justice, we don't want to continue with it, she is not going to look for funding for it.
And
But
I'll
if we're-
clarify, I'm not going to look at, what I'm going to do
No,
is I'm going to
right.
submit a request to move additional funding to cover Camp Justice from a different ERF category. That would be my action item.
Okay.
I
So
think Ania's trying to say he wants feedback on what Camp Justice is going to look like going forward, right? Like some changes or possible changes is what you're trying to say.
There's all agreement that we want Camp Justice to continue, but I don't want to have all that conversation that we just had for hours just be forgotten in 6 months. So if we could say, yes, Annie, go look for funding, we all agree Camp Justice will continue, but the programming and all the other stuff, that needs to come back pretty quick so we can give direction on that. That was my,
So
what I'm
could,
getting at.
maybe we have a
So moved.
gentleman's agreement with, like, say within the month?
Yeah, we're looking at
Is
June
that
10th
feasible?
anyways.
June 10th.
So I think
So-
we could
Okay.
include the homelessness on June 10th.
So, yeah, 2 weeks, 2.5 weeks.
Yeah.
Okay,
So we'll have 3 meetings in June.
okay. So,
Supervisor Holland will not be here on June 10th, just to know.
okay, so shall we provide you direction on extending the pilot
He's gonna be
program
in
to the end of
Hawaii.
2025, or do you need a vote?
I don't think I need that. I think I needed the direction to do that funding request, and I have that. And we can address the rest at the next meeting.
Okay.
Okay, we're
That
not doing
works for
June
me.
10th then.
Good, everybody?
We won't do June 10th then. We'll have you come back on the 3rd to do the homeless stuff, and then we'll do the other item at another date.
Let's say either the 3rd or the 10th, and then we'll let you decide. Does that work? Okay. And we do have some people, do we know if we have people that are waiting online to give public comment? Okay. So apologies to anybody that is online and that has been waiting to comment. If you would raise your hand right now, we will be looking for those hand raises and allow you a chance to weigh in on this very good discussion about homelessness and the services in Tuolumne County. So please raise your hand. Okay, I've counted to 10 in my head. Do you see any hand raises, Nicole? Okay, so I don't see any hand raises, so we will close the public comment portion. Annie, you have direction on the one item that you needed today. Is there anything else that we need for the good of the order for this special meeting of the Board of Supervisors?
Don't we have to vote on item 6 or item 3?
Right, that's for the adjourned meeting, so
Oh,
that we
okay.
can, if there's nothing else.
I got a handle.
or I know-
Okay.
Okay, so if there's nothing more for this special meeting of the Board of Supervisors, we will close